Okay, it's 9 o'clock. I'm going to call the Board of Commissioners study session for Wednesday, October 9th, 2024 to order. Opening ceremonies, will people please join me for the pledge? I pledge allegiance to the flag of the United States of America.
One nation, under God, indivisible,
with liberty and justice. Sam, will you do the roll call for us, please?
Certainly. Flynn?
Here.
Walter?
Here.
Nelson? Andrews?
Here.
Seifert? Morris?
Here.
Henschel? McAllister? And Jewett.
Here. Commissioner Henschel couldn't make it for business reasons. Commissioner Seifert is run late, and I do believe Commissioner Nelson is out of town today, so.
Commissioner McAllister?
I don't know about McAllister. I haven't heard anything yet, so. On the first public comment, Sam, will you please read the public comment?
Any person shall be permitted to address a meeting of the Board of Commissioners, which is required to be open to the public under the provisions of the Michigan Open Meetings Act. Public comment shall be carried out in accordance with the following board rules and procedures. Any person wishing to address the board may state his or her name and the township or district. Providing a specific address is not recommended. Persons may address the board on matters or issues which are relevant and germane to county government as determined by the chair. No person shall be allowed to speak more than once on the same matter, excluding time needed to answer commissioner questions, if any. The chair shall control the amount of time each person shall be allowed to speak, which shall not exceed 3 minutes. The chair may, at his discretion, allow an additional opportunity or time to speak if determined germane and necessary to discussion. Public comment will be solicited during 2 public comment periods noted in Rule 5.4 Order of Business. However, public comment may be received during a meeting when a specific agenda topic is scheduled for discussion by the board. Prior to the first public comment, the chair will indicate the topics on the agenda for which public comment will be accepted. Members of the public wishing to comment should raise their hand or pass a note to the clerk in order to be recognized. It shall not address the board until called upon by the chair. The board shall not comment or respond to a person who is addressing the board. Silence or non-response from the board should not be interpreted as disinterest or disagreement by the board. Please be respectful and refrain from personal or political attacks.
Thanks, Sam. Do we have anybody for public comment? Seeing none, we'll move on to approval of the agenda. I would like to note that there is no second public comment listed on the agenda, so I'd like to add that right before the adjournment.
Sounds good. Approval for the agenda as edited.
As amended, okay. Do I have a second?
Okay.
Okay. Have a motion by Walter and support by Andrews. All those in favor say aye.
Aye.
Opposed? Motion passes. Moving on, discussion 5A, 2025 budget personnel request. Nate?
Good morning, Commissioners. This is a date scheduled to hear the individual departments and offices' request for personnel specifically. And we have the Sheriff's Department and the District Court, judges, sheriff, and staff to make presentations to you specific to the personnel requests. And I would recommend that we start with the courts. Judge Cooney and Judge Stepka are here today. Thank you for changing your calendar to be here. Thank you.
Bob Cooney, Chief Judge, 86th District Court, and I'm here today to ask for boldly 2 positions, actually. The first is a treatment court coordinator and probation supervisor, and let's see if this thing works. It does. So when I say that title, you should know that the primary focus of this job is treatment court coordinator. We're thinking 75 to 80% of the position would be to coordinate our treatment court programs. And I want to start by talking about those programs just a little bit, and I'll try not to spend too much time, allow you to ask questions at the end. But we have 2 treatment courts. The first is a sobriety court, which is focused on felony drunk driving third offenders. These are all folks with moderate to severe alcohol use disorder. They're all high risk, high needs, which means that they are in need of a lot of services, and they're also at a high risk of reoffending and jeopardizing public safety. We have up to 60 participants. We've always got a waiting list for that program. And then we have our felony drug court, and that is also folks with moderate to severe substance use disorders. They are all high risk, high needs. We screen everyone who comes into the program with both programs with a screening tool to make sure that we're getting the right folks in the program. These are mostly opioid drugs, heroin, fentanyl, methamphetamine, and often we have co-occurring mental illness diagnosis along with that. Often these folks are housing insecure. They're coming out of treatment programs to begin with, or inpatient treatment programs, and that program has up to 30 participants. The second part of the presentation is going to talk about a community outreach court, and that would fall under the treatment court coordinator's responsibilities. These are the court's highest need offenders. So that's the main thing that I want you to understand, is that these are the people that are most likely to reoffend, most likely to be back in the system using jail and law enforcement resources, and that's why we want to focus on those offenders so that we can hopefully prevent that cycle from repeating itself. So, a little bit about treatment courts. I'm not going to go through all of this, but essentially what it is a intensive probation in lieu of incarceration. One primary benefit of treatment courts is that if they're working appropriately, they're saving jail bed days. But just as an example, with my drug court, most people start the program, they're in jail, they go to an inpatient treatment program, usually for anywhere from 30 to 90 days. They then will return to the community and engage in intensive outpatient therapy. There's rigorous testing for drugs and alcohol. The state actually tells us how often we're supposed to test people. It's twice a week drug testing and twice daily preliminary breath testing at the beginning of the program, and that lightens up as we go further into the program after the first year usually. There are also group recovery meetings such as NA, AA, and other programs like those. There are home visits to check and make sure that they are living drug and alcohol free in their homes. There are frequent meetings with probation officers, much more frequent than if they were on a normal probation. We also, the whole idea of the treatment program is to have an individualized program for each participant. And we do that by having drug and sobriety court team meetings each week. The team will meet, and that team consists of myself or Judge Stepka, the probation officers who are involved in the program, also a law enforcement officer, the prosecutor, the defense attorney, typically the person who is providing treatment or coordinating a plan of treatment for an individual, so the therapist. And so we try to make, and also a graduate of the program who has lived experience. We try to rely on the expert advice, particularly from the folks who are delivering the treatment, in making our determinations about how to proceed with sanctions or rewards And so there are also some specialized treatments such as women's empowerment, some programs called MRT, DBT. Everyone in our programs is required to maintain full-time employment, and that has been very successful. The participants are generally paying their own way through this program, and one of the big benefits that comes out of this is that someone who has been in active drug addiction in particular, they've lost the ability to perform some of life's most basic functions, keeping a checkbook, being able to pay their bills, those sort of things. And that's one of the important things that our treatment court programs do, is build those basic life skills back. So why treatment courts? I'm going to first talk about the benefits to the participants in our programs. We have better participant outcomes. The sobriety court has had recidivism rates as low as 4%, and those are reported out by the State Court Administrator's Office. Typically, they're more like 10%, but that's in comparison to people who do not go through a treatment court program that are up in the 50s. And so, in general, we have better participant outcomes, and something you should know about treatment courts is they have been very well studied for about 30 years now. This is something that a lot of research has been done by the National Highway Safety Administration and other organizations. There's a national drug court organization and a state drug court organization. And we actually try to quantify the improvements in participant outcomes, but what you'll see are improved employment opportunities. Both sobriety court and drug court offenders have the ability to get their driver's license back if they're in these programs, and those are state laws. They have to have an ignition interlock on the vehicle. That's to protect public safety, but it's a huge benefit. It allows them to live a normal life, get that job, and maintain it. Also, you'll note that these are all felony offenders coming into the program. We're a district court. We're taking a burden off the circuit court, but one of the benefits for the participants is they end up, if they can make it through the first year of the program, with no felony conviction. So again, it helps them to get those jobs, to have better career opportunities, and even better housing opportunities, because a lot of the low-income housing that you see around here, they won't take people with felony convictions. Mobile home parks, I learned recently, there's a state law that they can deny someone the ability to live in a mobile home park because of a felony conviction. So what we see with our participants are strengthened families. A lot of folks, it's not uncommon that they get their kids back while they're in our treatment court programs. They may have been taken away by protective services, and it's a tremendous thing to see people get their kids back and to know that they're going back to a good home because the person is being tested, because they're in our program, and they're making strides towards living drug and alcohol free. We also see better physical and mental health, improved self-respect and dignity, and again, those improved life skills. So in the end, we're helping folks become better citizens. So what are the benefits to the community? Reduced recidivism, which increases public safety, a savings in law enforcement resources, reduced health care costs, reduced emergency room visits, reduced homelessness, foster care, child placements, and again, strengthening families in our community. So I talked about the treatment court team, and those gray squares are the people that are involved in the court currently on our treatment court teams. I left out the graduates who are part of our programs as well. But the missing piece is that treatment court coordinator. So what is a treatment court coordinator and what do they do? I know you've got a copy of the presentation in your packets, and I'm not going to go through all of these. But I wanted to mention a couple of them. Treatment courts, again, are one of the most studied parts of our court system, and the State Court Administrator's Office requires us to keep detailed records on all participants. In fact, they even compare our participants to non-treatment court participants. They pair them up with someone with a similar criminal record and offense, someone else in the state, and they give us numbers back about how well we're doing. And in order to get all that data, what we have currently is our probation agents, the 3 treatment court probation officers, are logging all of that information. That's something that should be done by a treatment court coordinator, and that's typically the model that they're using in other jurisdictions. They also would do the grant writing. We write grants to the State Court Administrator's Office and get something a little over $100,000 every year. Unfortunately, SCAO claws that money back if we're not fully using the grant funding that we receive. And a lot of times I see money left on the table because we're not paying as much attention to our grants as we should. We're also not going after grant opportunities that I think are probably out there and available. We all know there's a lot of funding around opioid use disorder right now, and that's something that we're thinking that a treatment court coordinator could do a better job with. Also, right now, the courts are both undergoing a state certification process, and that entails folks from the State Court Administrator's Office visiting both our court hearings and our team meetings, making sure that we're following best practices and performing the way that we should. And that's a very involved process. We've handed that off to our deputy court administrator. But that's part of the problem, is that we can break that coordinator job down into several positions. We can hand some of the clerical work off to the probation officers, but now they're not supervising people. That's what they should be doing, is spending time with the participants, making sure that we're doing everything we can to help them. We've also got our administrator and our deputy administrator taking parts of those jobs. I'll tell you, about a year ago, we lost our deputy court administrator, Melanie Catanella, and I did an exit interview with her, and I asked her, what are some things that you think we should do differently as a court? And her number one response, in fact, the only thing she really told me, was, you need a probation supervisor and a treatment court coordinator, because I'm spending all of my time doing those jobs, but I'm not able to help Gwen, our administrator, with all of the other things that I'm supposed to be doing. And because there's no one person in charge of the coordinator position or supervising our probation office, it really gets lost in the shuffle. So the idea of the coordinator position came up for a couple of different reasons. Not only do we see coordinators when we go to conferences where we receive training on how to run our treatment courts, but our treatment court teams attended both a national training and a state training over the last couple of years. And in both instances, they recommended that we get a treatment court coordinator. So this is coming from the national folks, it's coming from the state folks, it's coming from what we see when we go to trainings for treatment court programs. Also, you're aware of the opioid settlement task force, and I know that's a whole nother conversation, but I remember being asked at one point, if you could have your ideal treatment court program, what would you do? What would you do differently? And this is what I said: we need a treatment court coordinator. And so I know that the task force itself set that as one of their number one priorities. And again, that's a big discussion. I'm not necessarily asking that funds come from that source. In my budget request, we requested, we mentioned that there were possibly funds there. There were possibly funds available from cannabis revenues. But we also said that this is a general fund request if we can't get money from those other sources. So, so again, what are we doing currently in the absence of a treatment court coordinator? We're sharing the jobs of that position between about 6 different people. The 3 treatment court probation officers, our court administrator, our deputy court administrator, and the office manager. Now I want to turn to the probation supervisor part of this. We have a staff of 8 probation officers, including the treatment court probation officers, and 2 clerks. They do not have a frontline supervisor. That is unusual. And the deputy administrator, again, ends up filling in to take over those job duties. One of the things I asked Ms. Cattanella about is, well, what would the supervisor do? And she said they would audit the individual probation officers, look to make sure appropriate emails are going out, that requests from probationers are being responded to. They would take a couple of case files from each probation officer on a regular basis and make sure that everything is being done appropriately. And that is not happening. And I can give you 2 examples. I don't want to get into names and that sort of thing, but 2 examples in just the last 3 years where, for one reason or another, one was related to health issues. A probation officer kind of disappeared from managing a caseload. And that resulted in a lot of embarrassment to the court, where we were finding out about and dealing with probation violations 9 months and a year later because we didn't know about those things happening. It was a concern for public safety. There are no contact orders in a lot of our probation cases, and so those were 2 very embarrassing situations that would have been caught if we had had a probation supervisor doing those audits, making sure that we're managing those probation officers the way we should. I asked our administrator and Sharice Shively, our community corrections director, do you really think that someone can do both jobs? And they assured me that they felt they could, and that is because the treatment court coordinator would already have most of the understanding and background needed to manage those three treatment court probation officers. And so this is just extending that part of the job a little further to make sure that the other probation officers are also being audited and doing what they're supposed to. So, I'm not going to go through all these responsibilities of a probation supervisor. I think I've kind of talked about that already. I'll let you review those. Just some historical notes. The court did have a probation officer or supervisor until about 2020. That was a probation officer. That was their full-time job. And then on the side, they were also a probation supervisor, and they got a little bump in pay as a result of that. And I think we had that position at least for 10 years or more. There were a lot of problems with handling it that way. For one, because of union rules, that probation officer was a union, a contract employee. They could not hand out discipline directly. That had to be done through our deputy court administrator or court administrator. And so we think this should be a management position, not a contract position for those reasons. The way that we did away with the chief probation officer or supervisor was because at some point we decided we needed the office manager position. And this is how we've handled these personnel changes in the past, is we kind of Jenga things around. We eliminated not just the supervisory role of that probation officer, we also eliminated a compliance officer, and there was one other thing we did in order to free up enough full-time positions to allow for the hiring of a full-time office manager. And I think if you look back over the history of the district court, you'll see that that's what we've traditionally done. I know we added a couple probation officers last year, but please keep in mind that those were positions that were reinstated after we voluntarily came to the board and said we think we can maybe get by without two of our probation officers. Well, that was a disaster. We're very thankful that you gave us those positions back. But other than the deputy court administrator, I think you'd have to go back to probably 2000 to find where the district court has actually added staff rather than reducing other positions to make room for other staff. And of course, since 2000, the county's added at least 20,000 more residents, and it just makes sense at some point our court needs more resources, particularly where over those same 25 years we've become more focused on rehabilitation and less focused on incarceration. And of course, I think everyone's agrees that that is a good change, but in order to have rehabilitation, you need programs, and programs cost money. So what is the bottom line as far as the costs go? What we did is we looked at a position that would be one step above a regular probation officer, one grade level higher than a regular probation officer. We're looking at someone with at least 5 years of experience, and so if you add in benefits, we're looking at a total cost to the county of $87,400. And before I go on and talk about the outreach court coordinator position, I'd like to know, Judge Steppe, do you have anything that you'd like to add? Okay. So then I'll open up for questions about the treatment court coordinator, probation supervisor position.
Questions? Commissioner Andrews?
Sure. Thank you. How long have we had the sobriety, when did we start the sobriety court and the drug court respectively?
So the sobriety court began around 2000. I think it was actually 1999. Judge Haley started that program, and to his credit, it was a novel program in the state at that time. Since then, we've grown to over 240 some treatment court programs in the state, but we were one of the first sobriety courts. As far as the drug court goes, I was involved in starting that court back when I was in the prosecutor's office. I saw the rise in opioid-related deaths and crimes, and actually talked to T.J. Phillips about starting a drug treatment court, and I believe that court started around 2018-19. He had run it for a couple of years before I took his position on the bench.
Walter?
Yeah, I had a question about, I like this approach, thank you for information. I'm going to use my microphone. Can you speak to the aspects of the treatment court regarding the sober living home and time frame? And we hear from pretty much everybody in the community that there's such a shortage of housing and a lot of people who need wraparound services and permanent supportive housing. Can you speak to what the capacity is like for the sober living home? Like how many people you anticipate might go through this program, what the time frame for something like this is?
So, if under ideal circumstances, everyone would be going through a sober living facility, but that doesn't always make the most sense. And so I would say at any given time, we have maybe 10 participants, maybe a dozen that are in a sober living facility. They're paying rent. One of the requests we had when we were looking at opioid settlement dollars was to help pay the first couple months of that because, as I mentioned earlier, most of these people are coming out of inpatient treatment. They don't have a dime to their name. And so the idea that they're supposed to start paying rent after being in a 60 or 90-day inpatient treatment doesn't really make any sense. Somehow people have managed to do that. And I try not to ask too many questions, but I would say at any given time, maybe a dozen folks are in those sober living facilities. But Mike, I'm talking about my drug treatment court. Maybe people in the sobriety court program tend not to go into those facilities as much.
We use the sober living homes a lot less than the drug court because most of our folks come into sobriety court already housed. But I think, Cherise, do we have about 2 people? 3? Okay. Three people currently in a sober living facility.
I'm not sure if that answers your question. I was trying to figure out how many treatment court or how many sober living beds we have in the county, and I was able to come up with a little over 40 when I was looking at the Cherise would probably know better than I do. I'm part of a state housing committee for sober living facilities, and that's why I was doing that research. But I don't know if that answers your question, Commissioner Walter.
Partly does, thank you. So the 40 total that are in the county or in the region, I'm assuming it's pretty full. What's your understanding? You said you know of 12 through your
A lot of
program.
times our folks have to wait for a bed to become available. And so that's very common. It's rare that they're looking for folks. Of course, they have to make their rental payments on their facility, and so they want to keep the beds full. But Sharice, would you agree with that? They're typically
So
at
we-
or near capacity.
Please
we have-
introduce yourself for people at
Sorry,
home.
Sharice Shive, I'm the manager of the Community Corrections Department. I'm part of the sobriety court and drug court teams. And I direct community corrections. We have, I think, 5 different providers that have recovery homes. And they all are independently run. They don't accept any, we don't fund any of those in particular. Some are run through Addiction Treatment Services, through Keys to Freedom Ministries, and some other independent contractors that run recovery homes. And I, at all times, especially when it comes to female houses, there is one female house that is run through Addiction Treatment Services and one through Keys to Freedom Ministries. And they are almost always full for the females in particular. I am never able, hardly ever, through my jail alternative placement programs, able to get a female into a recovery home timely. And by timely, I mean within a month or longer for those individuals. And so that's probably what is being faced in the drug court and sobriety court programs as well. There are obviously more beds available for men. All of those there are usually have a wait list, though. And those are some of our most precious people that we're dealing with, right? They're unhoused, they don't have anywhere to go, and we're leaving them in jail when we don't have a place to put them. And so that's part of when you were talking about the wraparound services, this is what the staff are doing, is trying to get them placed in all of these programs to support them so that they're active, able to be stable in their recovery. And so that is a concern all the time, is recovery housing, all the time, every single day, 365 days a year.
Thank you. That was part of the question was then where do they go? But it sounds like they're in jail until there's an opening.
Yeah.
at
We've had a little bit more success
recovery house.
getting them into inpatient recovery lately. It used to be very difficult to get a bed, but usually once someone has been sentenced, we've already got a plan in place for them to go to an inpatient facility, and sometimes even before they're sentenced, we're able to get them into inpatient because we want them out of the jail. So if we know there's a bed available, we'll let them go to that inpatient treatment facility, and we'll sentence them via Zoom or however we have to do it, okay? But usually we're able to get those inpatient beds within a week to 10 days.
Commissioner Flynn?
Besides the wait list for the recovery housing, you mentioned wait list for the program itself to be a participant in the treatment court and the drug court, correct?
That's true of the sobriety court. We've had a run of good luck, I'll call it, with a lot of graduations in our drug court. And right now we're reviewing a bunch of applications to be placed in the drug treatment court, but we've got some positions available there.
Would this position help with that? Assist with?
I think it would probably assist a lot with that. One thing that I would like to be able to offer also is the prosecutor's office will commonly offer a misdemeanor for someone who has maybe no prior criminal history, but they've been charged with possession of methamphetamine, that's a 4-year felony, or I'm sorry, a 10-year felony, or possession of fentanyl, which is a 4-year felony, and they'll offer a misdemeanor. And there's no doubt after we get an assessment that that person has the same high risk, high needs as the people, the felony offenders I'm taking into my treatment court. But right now, I'm just putting those folks on regular probation, even though I know they could benefit from all of those services. And I think there's no doubt in my mind that we could have that, a bigger treatment court probably even, if we had the capacity. I've limited purposely to 30 people max for each probation officer because I know from experience, once they get over that mark, our probation officers are frazzled, they don't feel they're able to do their job, and that's because of all the requirements that are in place and all the work that needs to be done.
Thank you so much.
Yeah, thank you.
So from what you're explaining, you've got 3 probation officers, 2 are assigned to drug court, to sobriety court, 1 to drug court, and that's where the 60-30 capacity is?
That's correct.
That's the limitation. I'll just echo, I think, Commissioner Flynn's interest in seeing capacity expansion, and to the extent a coordinator facilitates capacity expansion, I think that's a good outcome, and I think that's proven statewide and nationally that diversion is a good option. I'd like to ask about, in drug court in particular, does the drug court program support medically assisted treatment as an option for your participants?
Oh boy, that is a loaded question. We are required, as part of our certification, to allow MAT. Now, I am an advocate of medication-assisted treatment. I think it's the medically recommended option for a lot of folks. We do have folks in the program who are on a Suboxone program, and I think we have 3 participants currently who are on a Suboxone program. The reason I say it's a difficult question for me is because you'll need to talk to our circuit judges who have a very different opinion than I do, because we are acting as circuit court judges when we handle felony offenders. We have to follow their rules. So if someone comes into the program, I'm not going to tell them to do something that's not medically suggested, okay? But at the same time, I have to respect what the circuit court judges are telling me about their expectations for allowing us to handle our cases. So I've had conversations with the circuit court going back to Judge Power about this issue, and I want to be very respectful because I understand their concerns, their position, but I know that doesn't completely answer your question, but does that help?
Well, I guess what I'm trying to understand is if a potential participant would benefit from or is already part of a MATS regimen, would that prevent them from then being a participant in the drug court? And I would not want any barriers that limit the success or the eligibility.
It does not, and I guess what we do is we ask that person to talk to their physician, see if they're able to wean off in a healthy manner. After it becomes a misdemeanor case, and I didn't mention this, but this is a 3-year program for both the sobriety and drug court. They start out on felony probation for the first year. If they're successful, the prosecutor reduces the case to a misdemeanor, and at that point, I've been told I can do what I want, and I do. I'm fully accepting of medication-assisted treatment, and if that is the treatment recommendation of their physician, that's what I'm going to go along with.
Thank you. First off, I want to apologize to my peers and to everybody in the room today for being late. Perils of having 2 full-time jobs. I appreciate everybody being here today. And I'm a big fan of the program, have been for years. I could see it just in dollars and cents, how it's affected the community in a positive fashion, mostly to the taxpayers, saving the almighty tax dollar, which everybody knows is in limited supply. Do you see this new position that you're requesting? The 3 or the probation officers that you currently have, about how much of their time is spent doing this work that should be being done by the supervisor/coordinator position?
That is a tough one for me to estimate, but if you take away the grant writing, if you take away the certification program that we're going through right now, if you take away data entry and those clerical functions, I would estimate maybe a quarter of their time is spent on things that the treatment court coordinator should be doing. What do you think, Sharice? At least that.
All right, thank you.
I have a question on the sobriety and drug treatment programs. What is the, I don't know how you guys term it, but success rate or graduation rate percentages of the people that are in there?
I would say our graduation rate is around 50%. And I know that doesn't sound real great for a drug court but I'm talking just about our drug court
Okay.
program. Usually, the people that are not going to make it through the program, they haven't really committed themselves to living sober. And usually they are eliminated from the program very early on. And so there's a big turnover rate at the beginning of the probation. But I would say we're probably about 50-50 as far as people graduating and actually making it through the 3-year program. As far as the success rate of our graduates, we're scoring about or above where the national, what the statistics say, how well people do when they go through these programs, which is about 68 to 70% success rates. That means no recidivism within the next 3 years.
How does that compare with the rest of the programs in the state? Or the rest of the courts that are doing the same thing?
Yeah, like I say, we're about at or slightly above the state and national.
State and national, okay. Okay.
Judge Stepka's sobriety court, but sobriety courts in general are more successful.
That's not true. The sobriety court has about a 90% success rate. And as Bob mentioned, the recidivism with regard to graduates or folks in the program to start with it's on the lower side. A lot less recidivism from sobriety court here than very happy and proud about that and all the benefits that brings. So.
Okay, thank you. Commissioner Walter?
Yeah, just to follow up to that, do you have folks who, they're not ready, they're not committed yet to the program, so they drop out or they don't commit to it, and then they find later on that they are ready? Do you have people who kind of have gone
I've
and
had
come?
people come into the program very reluctantly, and they're just trying to avoid a long jail sentence or going to prison, and they can sometimes turn out to be my best participants. I had a gentleman who graduated, was it last week or the week before, and he came in with a record as long as your arm, seriously. And when he came into the program, I thought there is no way this guy is going to make it. And he ended up going through all 3 years. I don't think he had more than a single violation the whole time, and which is very unusual. We give all kinds of opportunities to mess up, especially at the beginning of the program. But he is now a successful father, grandfather, husband, and these are his words. And he's held a job for the last 3 years. He's just been a big success. And so he's one that I think maybe came into the program thinking he was just going to avoid the jail time. A lot of folks, I think, feel that way, but when they're in recovery, I hear it over and over again, they feel so much better, so much healthier. They didn't know what it was like to live drug or alcohol free. And that happens all the time. It's not necessarily how we decide whether someone's going to participate or not, because we know everyone's at a different place in their life when they come in. And I think at some point, though, there has to be that personal commitment for them to be successful. Does that answer your question, Commissioner?
Commissioner Flynn?
Just like kind of follow up after Commissioner Walters, of the 50% that don't make it through the program or leave the program, do you ever see them come back and attempt at a later date?
I have, unfortunately.
Is that only
Oh,
after
you mean
another?
attempt the program again?
Right.
I'm trying to think if we've ever, I don't think that we've ever done that. Now, we rely upon the prosecutor to screen out who's coming into the program. Under the statute, the prosecutor gets to make those decisions, and I think they make good decisions, but that may play a role in their thinking about whether, you know, if they've been through the program again, do we want to expend all the same resources on that person if they've already been given that opportunity?
Thank you.
Excuse me, Commissioner Andrews?
Thank you. Speaking of the participation and the eligibility, I appreciate understanding that the prosecutor has a role there. You indicated that there is a cost to participate to the individual. Are there scholarships to offset that cost, or what or is the requirement that you have to get a job and there to self-cover? How do we prevent that from being a barrier for
Yeah,
participation?
The cost of the program is a flat $1,600, and a big chunk of that is the attorney fee because, again, they all start out as felony cases. That's a $750 fee that goes back to the county. What I tell the participants, because I never want to fail someone out just because they didn't pay the cost, but I will warn them over and over, you have to get this paid in the first year. And the reason why I can feel good about that is because if they're maintaining a job the way that they're supposed to, if they're getting their finances in order the way that they're supposed to, they should be able to pay that cost, even though I know it's extremely burdensome. It's not like you and I trying to pay off $1,600 over the course of a year. Sometimes I really wonder how some of the folks in my program make it, but they all seem to be able to get there one way or another, and I think it does help to build those life skills. And so, you know, I thought about eliminating those costs as part of our request during the opioid settlement task force, but I'm not sure that that is necessarily in the best interest of the participants. I think they do need to have some skin in the game, and so I don't know if that answers your question fully or not.
It does, thank you.
Well, you were wondering if there's any scholarships available or anything?
And it sounds like not,
There are not.
Okay.
not on purpose. Just one more follow-up. Go ahead. I was going to switch gears.
No, go ahead. You might as well finish.
So I understand that Antrim County and potentially Leelanau are considering pulling out of the 86th, out of our court system. Would that free up capacity? Are there resources going to participants from those counties? And would that, their departure increase
Okay.
the number of Grand Traverse County residents?
So this is an excellent question, and I'm glad that you asked that. And I'm sure you've heard the rumblings about Antrim County, and they do want to go their own way. That would require legislation to make it happen. What I will tell you is that Judge Stepka and I have both decided that it is in the best interest of the court for Antrim to go its own way, and we've talked about the possibility of not separating from Leelanau County. Leelanau and Grand Traverse have been together since the Court of Appeals was established in 1965, and we've always had the same administration. So we're not looking at it separating from Leelanau County. But this is what you need to know, and we're going to be approaching the board at some point to give you more details about all that. Last night I was at Leelanau County's board meeting, and that's the first time I've publicly talked about that situation because the conversations have become serious in the last couple of weeks. So, but to answer your question, this would not have any impact upon our treatment course because we have exactly 0 participants from Antrim County. Their prosecutor has a very different attitude from the prosecutors in Leelanau and Grand Traverse County about the treatment courts. And I don't want to be disrespectful toward him either. It is difficult to run a treatment court when they're 40 miles and almost an hour's drive away, and it makes it more difficult for us to offer the same services. But that's a whole nother discussion, and it really doesn't matter. They've never participated, and so we have 0 participants in our treatment courts. We may have had a few historically, but in the last 6 years, I don't believe I've ever had one.
Commissioner Walter?
Thank you. Just a clarification, I'm just looking at the slide on treatment court coordinator / probation supervisor annual cost. So you kind of talked about them as 2 separate positions, but really this is a combined, you're proposing it to be a combined
Yes.
full-time position.
75 to 80% would be the treatment court coordinator job, and about 20 to 25% would be the probation supervisor.
Okay. So, thank you. That's how I understood it, but I appreciate the clarification that, I'm always worried about setting someone up for failure with putting too much on their plate or basically combining 2 jobs that maybe don't go well together. But I'm not in this world, right? I don't know that this is not a good fit. Can you speak to that concern, and maybe if you have somebody, maybe you have somebody in mind, or
I had the same concern, as I mentioned earlier, and I was convinced by our administrator and Sharice that we could combine the 2 positions, and maybe one of them could speak more fully about why they believe that's a good idea.
So.
Please introduce yourself for the people at home.
Gwen Taylor, Court
Yep.
Administrator.
Thank you.
Our belief and understanding is that this will be a successful combined position. The treatment court coordinator positions that we've researched and looked at around the state traditionally are not full-time positions. And so that went into our evaluation and deciding factor in combining with our need to also have a probation supervisor position. Those factors also, as the judge pointed out, this treatment coordinator position would be working closely already with our 3 specialty court officer positions. So combining those 3 with our other general probation officers, with those skill sets, with that mindset of balancing and looking at caseloads, monitoring, case data entry, those things combined, we felt that it made most sense, and it can be a successful position to have both as one.
Sorry, I was just waiting. I
don't know that I have a whole lot more to contribute besides what she said, except for that one of the, our plans is that when if we are afforded this position and the person that is hired starts, the majority of their time when they first start, I would say and have suggested for at least the first 6 months is to focus on the coordinator position. We have such a strong need with that right now to get that really to the point where we need it to be as a court to be successful and to be offering the best services that we can to our participants, and then moving in the supervision of the probation staff. It, in my opinion, did not make sense for one person to supervise 3 staff and another person to supervise 5 staff when they all have the same supervision needs and same supervision expectations. There's also the factor that as if there is one supervisor, you have staffing changes, right? And me as a supervisor of staff, I know my staff's strengths and weaknesses and what they're good at, and I know who might be good if I have somebody leave one position and who might be able to be moved into another position. I have the ability to mentor that person. I have the ability to as they're growing as a probation officer and they're a general probation officer, to offer them trainings and things that might benefit them in the future if they wanted to transition into a treatment court position. And so that does not make sense to me, to have two people doing different things with their staff, and not on the same page, right? I'm over here supervising this staff and you don't need to worry about them, and I'm over here supervising this staff and you don't need to be worrying about them. And I don't mean that in a negative way, right? But we all have our job duties that we're supposed to be doing. You both need to be knowing what everybody's doing, because you are going to overlap services for individuals. It did not make any sense to me to have two people to do that. But I have suggested that the bulk of the supervision come for the treatment court coordinator, especially in the beginning of all this, because we have such a need to get that organized.
Commissioner Morris, you have your hand up?
Yeah, I did. I had a question about, it was mentioned that sometimes substance use and mental health issues are co-occurring. So I was kind of wondering, in the realm of treatment, how are the mental health issues addressed? What percentage would you say that is true, and how is it being addressed?
So what you understand is I'm a licensed therapist myself, so I have a different perspective than probably anybody else here in this court, because that is my passion, right? Working with individuals with substance use disorder and mental health issues. I think you'd be hard-pressed to find somebody doesn't have what we call co-occurring issues if they have a substance use disorder. They go hand in hand. I don't think that you can quantify a percentage. If an individual is abusing drugs and they have had so severe trauma in their life, and that is 90% of the individuals that have a substance use disorder have experienced trauma in their life, that is going to go hand in hand with a mental health disorder. And so those individuals that come into our program are put into counseling. They have an outpatient therapist. They go into group counseling that helps work on their skills in recovery, but their outpatient therapist is the individual that's helping them work on whatever they need to work on. You're not walking in the door to a therapist office and they're saying, here is our bucket of substance use disorder and here is our bucket of depression. As a therapist, you're just working on that person's needs. And so we're putting those individuals into the programming that they need. That's why we say that it's an individualized program for each person, because we address that person's needs, not the group needs. And so we're addressing those needs. It doesn't matter what they are. Right, so I have the framework that I don't wonder if you've had trauma. You have had trauma if you are involved in the justice system and if you have been in jail. Right, you have had trauma if you are an addict. You have it. And that in and of itself causes mental health issues. So we treat all that.
Thank you. I appreciate that.
Any other questions? I got one more question. In your presentation here, it shows that you guys have up to 60 participants in the sobriety court and up to 30 in the drug court. If these positions are approved, will those numbers of participants increase?
As Cherie said, initially getting started, we want to focus on stability and getting this position. That will take work in coordination with officers. So I would say immediately that would be our goal and focus, and to work possibly with, what on that as far as increasing that.
Yeah, and I understand getting
I'd like
somebody
to
new up
add-
to speed and everything. I just wanted to, like, just say 12 months down the road, what's the chances that these number of participants would increase?
So the idea here is not to increase the number 90, because that, in order to do that, we would need more probation officers. The treatment court coordinator is not being brought on to manage cases. They're being brought on to make it easier for the probation officers to do their jobs. And I get where you're going, that if you're taking away some of these clerical functions, is it possible that those 3 probation officers can do more? I think it's possible. Maybe, they'll say, okay, I'm good with taking on a couple more, even though I'm at my 30. We've had some of them manage as many as 35 people in the past. But the idea is not to add probation officer resources. I think it would make it, like right now I mentioned our numbers are down in the drug treatment court, and I think it's because we're not looking at the numbers, looking at who's going to graduate and who's coming into the program and saying, hey, we've got capacity prosecutor, which is exactly what we did a few weeks ago. We talked to the prosecutor and said we've got some space, so we know there's a need, and I think that's where we would see maybe an expansion of the actual capacity in the programs, and maybe being able to take on a couple additional participants when there's a need to do so. Because we do, especially in the sobriety court, we've turned people away regularly who desperately want to be in the program because they know in his program especially they get that driver's license as long as they're using the interlock device, and that's just huge for people.
Okay, thanks for clarifying that. Go ahead, Commissioner Andrew.
I just wanted to, sorry, thank you. I just wanted to the point of increasing capacity, I do think there's several of us who have asked, who are interested in seeing the capacity increase, especially if we're putting additional funds in, especially if part of the additional funds support grant writing and other opportunities, not giving back grant money, but using what we have and then also hopefully expanding that. It also sounds to me like before you would commit to increasing capacity and participation, we would need to have a discussion about what does it look like for the probation officers once there's a treatment court and a supervisor in place lifting some of their duties. I would be interested, before we do this again next year, assuming I'm still here next year, that we would hear from the prosecutor about how many people are not being recommended, what this, because we're just seeing maybe a tip of the iceberg, so we're not seeing, and it doesn't sound like you're necessarily seeing either, how many people might be eligible if there were more openings. Would it justify an additional probation officer for both of those to expand their capacity going forward? I think it's premature today to do that. It doesn't sound like you're asking for that at all, but I do think that that's a conversation that's would be a good thing for us to talk about going forward, and would obviously need to be supported by some data showing, what capacity changes happened over the course of the year, assuming this moves forward.
As I mentioned earlier, we have a real need for a misdemeanor drug court because, like I say, every week I'm sentencing someone on a misdemeanor, but they've got the same high risks and high needs as the people in the drug court. But I appreciate that you're thinking about letting this all shake out if you approve this position, to give us an idea where we stand, because I think it is a big change if it happens.
Are people looking into expanding it to have a misdemeanor drug court as well? Because it does seem like catching them on the misdemeanor, helping them get into a system to help them before a felony conviction would make sense, but...
Well, our Sharice was just pointing out to me, we used to take drunk driving second offenders in our sobriety court. We have such a need for that program that we're no longer able to allow those folks to come in, and so there's another opportunity that's out there. I'm not sure if that was the exact question you were asking about, but there are a lot of misdemeanor cases out there, though, that we're not addressing.
So is that mostly because we don't have enough probation officers? Or it looks like, it's a very involved program and there's probably a lack of capacity at all those different levels, or can you speak to how that program might scale up?
It comes down to the number of probation officers that we're willing to commit to these treatment court programs. There's also a capacity limit with the number of judges, because I'm sure if we talked about adding another treatment court program to Judge Stepka's docket, he would have some difficulty fitting that in. Going back to Antrim County, that's one of the reasons why we think maybe this is a good idea, because it would free up more of our time to focus on our treatment courts and those issues.
Anybody else? Anything you want to add, Judge?
Nothing else I want to add on this position.
Okay.
So now I'll go on to the outreach coordinator. So the idea of a community outreach coordinator originated, at least in this case, there's some history here, with Lauren Tribalock and the interim city manager, who came to me last year about this time and talked about some issues they were having with the homeless population, and what could we do to maybe change the dynamic there. And I mentioned that, well, we used to have a community outreach court, and that court started around 2017-18. We had someone here on a grant fund, and I don't know what the grant was exactly that allowed her to be in our community, but her name was Heather Abraham. Some of you might know her. She was our program coordinator. She put the whole thing together. She got a bunch of community agencies like Goodwill involved in the project. We set up the ground rules for who would be eligible. We had a treatment court that was meeting regularly. Actually, we used to meet over at Central Church because a large number of our homeless folks spend time there, community meals, that sort of thing, and also at the homeless shelter when it was open. And we would meet with them there because that's where they felt comfortable and safe and willing to show up, because they weren't intimidated by the courthouse itself. That program went on for about 3 years, and the big change was when Heather Abraham left. Her grant, I don't know if her grant expired, but she had better opportunities. She's actually a professor out at Georgetown University, last I knew. And she modeled the whole program after something they were doing in Washtenaw County. So it seemed to be a fairly successful program, but after she left, as I said, it kind of fell apart. When it really fell apart was with the pandemic, and we couldn't hold court hearings anymore. It just wasn't possible to do it at the time. And so the other factor that played a role is, now I remember the position we eliminated to get our office coordinator. That was our collections clerk. And so the main incentive for folks to participate in the community outreach court at that time was elimination of court costs and fines. And to someone, it was kind of surprising how big of an incentive that was and how important it was to the folks that were in that court, but it seemed to work. But now we have a private agency doing our collections, so it's much more difficult for us to reach behind the private vendor and try to figure out how are we going to eliminate these fines and costs because it's not being dealt with in-house anymore. So what I said to Lauren and the interim city manager at the time is, we would be willing to resurrect the community outreach court, but I'm not going to do it if I don't have the resources to do it. And the thing that made the program work was Heather Abraham. She was working full-time at that job. She had partner agencies who would refer clients to the court. So they would decide, here's somebody, Goodwill, for example, we've got someone living here, and we think it would be important for them to be involved in this program. And so they would have to show up at the court hearings and discuss their progress, how they're, whether they're following the rules, that sort of thing. So obviously that's a big expense. We thought of some other things that would make the court successful that we use in our drug and sobriety courts, and those are mentors. Those are folks with lived experience who are willing to spend time one-on-one mentoring that person. And so we put in a $15,000 budget item for that to hire 2 folks. And we've tried to use volunteers in the past. It works for a short time and then it falls apart. So we put that in the budget. We also put in $5,000 for some incentives. I've got, I don't know if I listed those numbers here. Oh, slide 19. Okay, well, they're on slide 19 anyway. And some other expenses that we thought would be helpful to make the program successful. When I talk about incentives, we give out small rewards for someone who's homeless. A bus pass is a big deal. And so we're talking about incentives like that. Sometimes it's just a certificate showing they completed the program or they've advanced to the next stage. The idea of a community outreach court would be to connect court-involved homeless people to services. And every week, in fact, yesterday in my courtroom, here was a homeless person who I've seen about 3 times now on past bond violations. The violation is not showing up to court. And when that happens, a bench warrant goes out. There's really no other way to deal with it. It may be a 50-mile warrant where, we're only looking at picking them up if they're within 50 miles of the county. But that means law enforcement goes out. They have to make an arrest. Then they take them to the jail. And then that person sits in jail until we can schedule an arraignment. And then that person gets arraigned by the magistrate. And then they show up in front of me. And then I have to make a bond decision whether to release them or not. And it goes on and on. And so I release them. They tell me, oh, I've got a place to live, or I've got, things have changed, or I just, whatever the situation is. Obviously, if it's the first time or maybe even the second time, I'm going to let them out. It's a trespass charge or a disorderly drunk or something like that. I don't want them sitting in jail taking up a bed. But there they are again, a month later or 6 months later, and the same resources are being expended. I think having someone in the court, kind of like the quick response team's Jenny for the city, would be helpful to get these people on the front end, have a friendly face that they can talk to, find out what their living situation is, if their address is 222 Cass or Goodwill Inn or wherever it is, have that information, figure out how we can get those folks to court or at least be able to contact them when they don't show up. So that would be one goal. The other is to get them into services right away. If there's some availability for housing, if there's a need for community mental health to get involved. The idea is to reduce recidivism, to save law enforcement and court resources, because there's a lot of time being spent. I would say at least a couple times a week, and probably a lot more than that. I have someone in the very situation I had yesterday, and I think Judge Stepko would say the same thing. Some of these offenses are not disorderly drunk or something like that. They're assaultive crimes, and that's a concern as well. It would enhance public safety if we can make sure that we are, in fact, getting people to court, reduce incarceration days. I think I've talked about the indigent defense attorney costs because every time someone appears in court, we get an attorney on the line. The idea, again, is better outcomes for both the participants and the community. I want to talk about the old court once again. That operated from about 2017 to 2020. Again, we had a steering committee. It was based upon both a national and a state model and fell apart. Partners that were involved included the prosecutor, the sheriff, the city police, Goodwill, legal services, community action agency, the health clinic, Traverse Health Clinic, Women's Resource Center, Dance House. All of these folks signed on to our agreement and were referral agencies to the court. So then we get to how much is it going to cost. And here we're looking at hiring someone in at the same salary as a probation officer, essentially. The best fit would be someone who has a great deal of experience with the homeless community, preferably someone who has a social work background and likes to do this type of work. With benefits, we're looking at a total cost of $82,000. And then slide 19, I guess. These were the other expenses we included: the mentors, the incentives, drug and alcohol testing, because how do we do even the most minimal testing for someone that doesn't have any resources? And BDAI, I think, picks up a lot of that. So, and Indigent Defense Council. So it's a total of, somehow the number went up. It's 125,142. I'll commit to reducing some of these other expenses other than the salary and wages to 120 because that's what I promised the city. And you'll see that the city did sign a letter saying that they are committed to picking up half of the cost. They recognize that this is a city-centric issue, although, of course, Garfield Township has its share of the homeless population, and I think you'll find that there are housing insecure and homeless people in all of our townships. So we've got a split cost of $62,571, as I indicated. That the numbers changed after I looked at all this, but we would keep it to $60,000 the first year. So with that, I do want to ask Lauren to speak.
Thanks for listening to us this morning about all this. I was involved.
Can you please introduce yourself for the public?
Lauren Tribble-Laucht. I'm the city attorney for Traverse City. I was involved with all this when Ms. Abraham really was involved and started the court as well. And I saw out of my office, I do the ordinance violations. And many of those that come across my desk are folks that are experiencing homelessness. And oftentimes, what I'm doing now that we have QRT, and we really have a robust partnership with, I think we've got 50 or 60 agencies working with the police department and QRT, is I call up Jennifer home and I say, I have so-and-so on, an ordinance violation. What does this person need that we can hopefully get them connected with so that I don't see them again and the court doesn't see them again? Because what we find is that we have these ordinance violations going on. For folks that are living out in the open, they have nowhere else to go to the bathroom. They have nowhere else to sleep. And so we get these ordinance violations that are just repeated, and we know we're not getting to the root of the problem. And it's a revolving door of costs and time and energy that we're spending, and really not helping people get out of the situation that will benefit them and the whole system from a cost perspective. So I think that in speaking with the judges and the police department, we did see success when the community court was going on. And these folks have somewhat different needs than the regular sobriety and treatment courts that we're already seeing. And we have the opportunity to connect them with many of the same service providers that we're already sort of coordinating in the QRT, and hopefully moving them out of their situation of homelessness, and then we don't hear from them again. And that's what I've seen as well. I've had folks that come and see me regularly. They come by my office because they have a ticket. They don't always understand what the process is. And once I have an opportunity to work with partners and work with Goodwill and with Jen and the different providers, and they either get housed or they get the help that they need, we don't see them anymore, and that's good for everybody. So I'm happy to answer any questions. The City Commission is committed. They understand the benefit of this program as well. So,
Judge, is there anything you want to add before we go to the questions?
Just that you should recognize that the court is a focal point for homeless and housing insecure people. We have an opportunity in the court to make an impact because we do have some leverage over these folks. I use that term lightly, but we want to see them be successful and stay out of the court system, but we have a lot of folks coming in. The prosecutor is on board with offering incentives in terms of plea bargains and actually prepared a memo laying out some of the incentives they could offer. They identified 78 people with hundreds of cases last year that were they listed their address as homeless. We don't know if that's everyone because some people choose not to list that, or they might put wherever they happen to be laying their head at the time, but 78 people who identified as homeless last year.
Questions? Commissioner Flynn?
Thank you very much for this. I have attended a few community meetings recently where the city police chief has attended as well and has mentioned bringing forward new ordinances that I feel would result in more ticketing of the unhoused population. So I'm wondering how that would affect this situation if we're going to have more folks being ticketed.
And I have the city attorney.
Yeah, the police chief has presented a safety plan that's sort of in the same conversation with the Safe Harbor year-round shelter and the Community Cares Coalition proposal that is unfolding at kind of a parallel. I think that it's, I want to say that the community court is not an opportunity to hand out more tickets to get more people in the system to get them, to get them services or something like that. I don't think that it would significantly increase the amount of tickets that are written. The police department, I've had a lot of conversations with them. They have a lot of discretion about giving tickets, right? Like every time you get pulled over, you don't get a ticket either. And so they really strive to have compliance at the moment. And if they don't have compliance, then their last resort is to give a ticket. And so I don't think that the new ordinances that we're talking about, they're sort of more to fill gaps of things that maybe we've seen this season that need to be addressed that we don't have a really good opportunity in our existing ordinances. But I don't know that that is really going to significantly, multiply the amount of tickets that they're writing. I don't expect that at all.
Thank you.
Commissioner Andrews?
Heather Abraham is my friend, and you cannot replicate the work she did for $59,000. And I'm quite serious when I say that. She worked 80 hours a week on that program, and she's an attorney with the highest levels of education. And what she was doing was advocating for the people who needed her support. And my concern with this proposal is there's $7,000 for advocacy for people who need support. This is not a replication of what Heather Abraham was providing when she ran this court. And my concern is that we're adding an additional layer of middle management into the program and not directing services to advocates whose sole interest is to help that person as opposed to the judicial system. We know we need advocates for people whose interest is that person. We know we're providing QRT, we've got Safe Harbor going full-time, we've got a lot of resources going into getting services through Goodwill, wraparound services. I am concerned about adding another layer of people who connect people to services instead of providing more services. And that gives me pause, especially when we're talking about just 10 minutes ago, finding ways to increase capacity to one of the key issues here, which is the co-occurring substance use and sobriety courts, which could and should be also assisting with folks who are coming into the justice system. To Commissioner Walters' point that we should be looking at misdemeanors, we should be looking at drug court expansion as a proven process that works. So at least I've got more to learn about this, but my initial concern is that as we are seeing, I'm just not convinced that sitting here today, we need to add another middle person as opposed to somebody whose job it is to replace what Heather Abraham was doing. She was doing it first through the Equal Justice Works grant, and then she moved to the Legal Services, was co-sponsoring her services, and they had an attorney whose sole job it was, or part of her job was to be that in the civil system when people needed that support. So I'm open to it. I'm interested to hear what other commissioners think of the proposal, but I am concerned that we need to expand the capacity for services as opposed to the connecting people to services, which we seem to be trying to do a lot of.
Guess in response to that, what I would say is that even though we're classifying this person as a probation officer, we're not going to call this person a probation officer. They're going to be a community outreach coordinator, like a QRT person, whose very job is to help people get to the right services. And in addition to that, we've got these two mentor positions, and running a treatment court, I know that when you have someone who is meeting one-on-one with another person, that is probably the most effective way to keep that person in treatment, whether it's going to mental health services or whatever. It's a small amount of money, $15,000, to do that, but we're modeling that off what our existing treatment courts, how much we've dedicated in those programs to those services, and that we find is effective and appropriate. As far as the Indigent Defense Council, those are really legal services to the court, not the type of advocacy that Heather Abraham was doing, I'm sure. And she was outstanding, and everyone absolutely misses her and all of her energy. I think she would be happy, though, if she could see that we're trying to resurrect the program. But I agree, it needs to be done in the right way. But I think you should think of the resource person, the community outreach coordinator, the mentors, the incentives, all as more direct services, even though it's not specifically mental health counseling. I mentioned the person I'd like to see in that job would have a very good understanding of the homeless population in our community and hopefully have a social work background. I'm not looking at someone whose primary job is to act as a probation officer. I'm looking for someone that can make a real difference in people's lives.
Any other questions? Commissioner Seifert?
I have some statements and questions. I have mostly statements. I apologize. I share some concerns. Also, I don't think a 50-50 split is going to be an easy sell to my constituents for this. I mean, the vast majority of the problem is, and the concern is, I think we need law enforcement and court involvement to get people help, because obviously they're not getting help themselves that can be helped. That, say, hey, you know, as a corrections officer for a better part of a decade, sometimes you had to use your leverage, to quote you, to get people to get their lives together. And then they're not allowed that opportunity because, quite frankly, in my opinion, the law is not being enforced. But where do you send them and what do you do? It doesn't necessarily come down to dollars and cents. Having said that, I don't necessarily think that even though they're not a probation officer, but they are a probation officer, it's probably not an appropriate thing. I'd like to see a little heavier requirement for that. I get it. It's a little more money. But my concern is we're going to make another probation officer. You just ask for some help for the probation officers that we have. And I'm not to cut off the sheriff's office, but they're looking for something that's similar for their aspects. We're kind of looking at it as this piece of pie and this piece of pie and this piece of pie. When in my opinion, there may be perhaps one higher qualified individual that we pay a little bit more can justify do all of those things, and then maybe supervise some smaller staff as opposed to, hey, I'm just this. And I don't mean to say that you're just a probation officer, but this is a heavy lift for somebody that's a probation officer. And it's like, and if I was in another department and I was middle management, you know, the American way, and I'm like, well, you know, you're just kind of probation officer. Go back to your department. We'll deal with our department. You deal with yours. I think we're way beyond that. And I'm not a big advocate of dipping our toe into the homeless thing, but it's a community problem and we have to address it.
Anybody else? Commissioner Andrews?
Yeah, my perspective is that the mentors and coaches sound like an outstanding value to the community. That to me is a no-brainer that you should have that and they should be supportive. And it sounds like they can provide a lot of value for the amount of value for the mentor and value for the person who they are helping. I would also like to believe that since this has been grant funded in the past, it could be grant funded again, and that goes back to your point in the earlier presentation that if we had a treatment court coordinator whose job was to help find grants, that we could do that. I could see that the county could support sort of a seed money approach or an outsource. What concerns me about this, of course, is that this is a permanent position. The city's commitment is helpful. I don't know that we can assume it would continue indefinitely. So I think once we add an FTE to staff and basically a new treatment court, we are creating legacy costs for ourselves, and that would give me pause, especially where it's a new treatment court where we've got some existing that we could ramp up that might sort of meet some of the same needs for. But I would be interested in a way to contract and on an annual basis so that we're not creating a staff person, and we could test it out as a way to see if between the grant writing, between the other programs, between other services that are coming online as we speak, between shifting as Ms. Tribolock said, the Safe Harbor is proposing to go year-round. We believe additional day services. They are going to be providing a resource manager. We know there's more housing coming online with caseworkers and permanent supportive housing, which are really good, proven values to get people to their court appointments and to their mental health appointments, and that could become duplicative or collateral. So anyway, my perspective is it's not the $60,000 for the county seems like a good value for this year, and I would support it, but I would prefer to see it as an allocation into a fund that is not creating a legacy for this year, and maybe something we could sort of a pilot that doesn't automatically create the FTE.
You know, to follow up on that, I'm not opposed to a contract position. I actually had thought that the best way to have that person spend their time for the first month or so is to look at the jail data, provide some background so we have metrics so that we can see whether the program is effective or not. Because if it's not working, you know, we shouldn't spend the money. But and you know, these community outreach courts, they're very novel, unlike the drug and sobriety courts that have a lot of evaluation and testing behind them. So I appreciate all the comments because I think those are all concerns that I have as well.
Anybody else? Minister, you have anything to add? You have anything to add, Judge?
No, I'm going to get the grappling hook from the sheriff here pretty soon if I continue. So
Yeah.
I appreciate all of your time and attention, and we look forward to whatever your decision is. We appreciate.
Thank you, everybody. And we're going to go ahead and take a short recess before we get on to the sheriff. So we're in recess.
Thank you, Judge, for rearranging your dockets.
Right.
Thank you.
There. I know, I'm all foggy. It's cool. It's cool.
Unlike everybody.
We're going to get started in about a minute here, so please take your seats.
How's it going, Sam?
It's going. How you doing?
Good, good, thank you.
Well, maybe not all of it, but you know,
Is this your
I
stuff?
gotta give them credit.
Put this on the calendar. I'm like, what?
General.
For honest.
Confused because it was already out there and advertised, so I was like, wait a minute. There was like a Friday thing.
Yeah, and then.
Well, the other thing is if we approve that first position there.
No, I'm not going to start. It's really good.
Okay, I'm going to call the meeting back to order at 10:47. Just a note that Commissioner Flynn does have to leave early today, so she may not be able to stay for the whole topic, depending on how long you guys take and stuff. But anyway.
It's not you, it's me.
When do you leave?
But I have to leave at noon.
Oh, we'll be done. Well, we'll be done. Whether you guys-
Sheriff, welcome. Let's go ahead and get right into it.
Okay, good morning. Mike Shea, Grand Traverse County Sheriff. First, I want to thank you guys for having this study session to at least hear what our requests are. You're going to hear a similarity when we were talking about the jail diversion / discharge planner. The common theme this morning was, what my takeaway was is there a better way than just merely incarcerating people that, for lack of a better term, may have made a mistake, and maybe we can handle that in a better, more appropriate way. So you're going to hear a request from us through Captain Barchef for a jail diversion / discharge planner, combined position. I want to make one thing very clear on both of our requests. They are non-union, non-certified law enforcement positions. They are not corrections officers. They are not law enforcement people. The other thing on the discharge planner and jail diversion, we've had both of these. It actually was 3, one could almost say 4 positions. They were provided through Northern Lakes. Due to funding, they've gone away. If the judges were here, I am very confident and comfortable telling you they are in full support of the jail diversion program that we had and we're building. So when Captain Barchef presents his very short PowerPoint, hopefully it will tell you kind of what we were doing and no longer have. We, in an attempt to be efficient, and I know that Commissioner Andrews and I have had conversations about budgetary things, trying to be fiscally responsible, we are combining that because we believe we can do so through one person if it is the appropriate person. Moving on to the crime analyst. We are, I commend this board, first of all, on taking steps to create a strategic plan. This county is growing. No one can dispute that. You know, with populations nearing 95 to 100,000 people now, and it's continuing to grow, and with national recognition, we are a proactive and progressive law enforcement agency. We are one of the only agencies of our size that does not have a crime analyst on staff. We have to rely on our own resources, which are very taxing to our Detective Bureau and others, as well as other entities such as the Michigan State Police, which they are a great partner to work with, but they are in Lansing for the most part, and we are here. And if we need something now, it's much easier to have someone in-house than dependent on someone else. So what I ask you to do is to listen to our brief presentation. Captain Clark has presented you with his PowerPoint. I don't see a need to go back through that slide by slide. I know he is here. We would rather answer your questions to keep everyone's time, at the forefront of what's going on.
Captain Barchef has a PowerPoint. We have Tony Stanfield here to give input on why we feel the jail diversion / discharge planner is so important and how it was working before. But I think questions are going to be the best way to work our way through this. And so I ask that you forget about the legacy costs, because we're trying to combine multiple positions that we already had on one side of this to mitigate some of those legacy costs, and recognize that your strategic plan identifies that we're a growing community, and with that growth, we have to grow with it in order to handle that growth effectively and safely. So with that, I'd like to turn it over to Captain Clark, who will assist with any questions you have on the crime analyst portion.
Captain Chris Clark. Commissioners, you received the presentation and had some time to review it. I'd like to just hit a few highlights. Like this slide says, we love technology when we're trying to build cases because we have to be accurate in those cases. But with that, you then recognize that you have that detective at his desk or her desk going through all this technology to try and identify who the suspect is or where the suspect has been. So we looked at other agencies, and they have been developing civilian crime analysts. So with the crime analyst, it then allows the detectives to be out interviewing victims, interviewing witnesses, preparing search warrants. It allows them to be more of a victim-centered investigation. Trying to hit the highlights here for you. One of the reasons that it's a civilian is obviously we're having difficulty finding qualified law enforcement candidates. So other agencies recognize and are having that same problem, so they're going with civilian crime analysts. So
I'm sorry, I'll wait.
So what they're doing is they're pulling from retired law enforcement, retired military veterans in the intelligence field, and Western Michigan University has a cold case program that we're actually working with on some of our cases. Some of their students have also received education in this field. I'm going to jump to a part that I didn't provide in the PowerPoint is, Chris, how are you going to measure this? So we meet with the detectives monthly, and where are their cases? We document when they receive a case, when the case is closed. All this technology, some of the stuff you're seeing on the slide, we monitor the usage of that. How many hours are they using it? How often are they using it? So we'll be able to also look at our record management system and look at our cases and see warrants authorized, cases closed, the number of cases of certain types of crimes. So I know I'm speeding through this real quick. Commissioner Seifert has a question.
Well, it sounds like you're looking for statistical analysis type personnel as opposed to law.
Correct.
That was kind of my question was.
And some of these agencies that you saw on the slide that already have them, they're reaching out to us right now. Grand Rapids, Wyoming, Kentwood. And they're sending us law enforcement intelligence bulletins. Hey, this person is committing this crime in Grand Rapids. We're trying to do our best to look through those bulletins, but if we had a crime analyst, we could communicate more effectively with those analysts down there to try and solve more crimes up here or keep our community safe by working with them.
How hard do you anticipate this position to fill?
Well, we have a unsolved homicide from 1989. We're working with Western Michigan University cold case program, and one of the students that graduated last year already reached out because she had heard. So I don't think it's going to be difficult, Commissioner.
Okay.
So this sounds like it's kind of an entry-level position for that field. So, I went to Grand Traverse County. I worked a couple of years. This is what I did. So now, $5 an hour, $40 an hour.
I don't think so, Commissioner, because when we worked with HR to determine the classification, they looked at all these other agencies, to include the Michigan State Police. So they made it so that it's very comparable to within the state where we're at.
I'm assuming that while this person's studying the metrics of everybody else will be studying their own metrics as well. They're successful in saving you money.
Oh, correct.
Microphone.
Sorry. Metrics. My apologies. So they're going to be providing data for us to analyze about their cost effectiveness and effectiveness.
I think so. I'm trying to understand what you're looking for there.
So my understanding is you're looking for an analyst, who's going to help, from what you said, people look at your detectives and how they're using technology appropriately and most effectively, and all the other technology, what percentage of cases are closed. Is that correct?
No, the analyst is actually going to be involved in the investigations. So a detective can say, hey, I've got this person, Joe Smith, maybe 50 years of age. Can you use this law enforcement resource to try to help me identify a suspect? While the analyst is doing that, the detectives are out actually interviewing the witnesses, interviewing the victims. And they can come back and then take that information from the analyst and say, hey, we have identified this person, Joe Smith. He lives at this address. Does that make sense to you?
Yes.
They're actually going to be an active party of the investigation.
How many detectives do you have?
10.
If this passes, I would like to make a suggestion that in 2 years' time, when you say, hey, I need to have another one, those metrics that I'm asking for, bring them to the table, saying,
Oh, sure.
this is our success rate with having this person, this is how much money we've saved, blah, 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 blah.
Well, I will do that. I mean, we have the tools in place to measure it, Commissioner, so.
Okay.
You want to continue on before more questions?
No, I'm
or-
good. I'll just take questions.
Okay. Commissioner Walter?
Thank you. Learning more every day. So thank you for shedding more light on your world for us. Previous presentation we saw about crime, overall crime rates have actually gone down in some ways, but it seems like there's more and more high tech or cyber or fraud, or is part of the desire to have this person because of some of the change in crime, or can you speak to that and how maybe that world is just different and why you would need somebody with this kind of different expertise?
You're correct. The complexity of the crimes has gotten very large. I mean, so the investigations are more complex, trying to identify who this suspect may be. To address the crime rates going down, if you're using national statistics, I would question those. Because what happens is locally we report our crimes to the state. Say we have, and I've done this before for other boards as well. We have someone that goes to your house, they break into your house, they steal your car, and they assault you. They leave. We catch them, they get arrested. We report all those crimes to the state. What the state does is they take the most severe crime and they drop the rest of them away. Then that gets reported to the FBI, so that home invasion is the one that it gets documented for national stats, but that assault, that car being stolen, aren't being documented from what you're seeing on the news, in national news. Does that make sense? So we like to use our statistics.
Yeah, and we did get a presentation on that in the past, and it looked like, crime is changing and some of those numbers are going down, but.
Well, I think one thing we need to understand, though, too, I mean, even if we're not recording as many crimes, our call volumes are still escalating every year. Is that still correct?
I'd have to double check with Captain Brinks, but I think you're accurate.
Yeah.
So I'm just going to refer you to our audit from last year, which showed that last year's 911 was the lowest number of calls to dispatch since 2016. I assume that's accurate. 72,169 last year.
I have not seen that audit, and I would want to review that audit, because my call screen that I watch on a daily basis certainly is not indicative of that.
So it's Page 183 of the audit from 2023.
Was that from Central Dispatch, I assume?
It's 911 computer-aided dispatch calls.
But for our county, I
Yes,
assume?
for Grand Traverse County. And it's got a decade of data. And I mean, it's just one piece of information. I'm sure there are other points of information, but
Because I'm nosy.
I just want to the point that data is helpful.
Yeah, well, some of those calls are medical related, they're not
course.
crime, so
Right.
that's all mixed up in that, too.
I would love to come back at another time and give you a year-end report and talk to you about what the Detective Bureau does. And I've done that in the past when I was a patrol captain as well, so that when we get to this point right here, so that we're all educated at where the sheriff's office is at.
That'd be great.
Would be. Does anybody have any other questions for Captain Clark? Anything you want to add before you turn it over to Captain
Oh, I do
Barsha?
have another question. When we
Oh.
did a tour, things looked really tight over there, space-wise. And I know that's, big part of facilities master plan is looking at those spaces, but it didn't look like there was a lot of extra space for offices.
We have a space in the middle of the Detective Bureau that complex cases where we have multiple detectives working, we're in there going through the case. There's an area in there that we've kind of identified for that analyst. A lot of the technology we already have and have already put in the budget for the monitors and the computer and stuff like that. So we're not looking at a large cost in equipment.
Okay, so a lot of the software costs are already things that you're paying. You're not
Correct.
looking for new platforms or anything to aid.
Correct. Yep.
Are we looking at the cost of a vehicle for that position?
No.
Okay. Anybody else? Mister, you have anything to add?
No, sir.
Okay.
Thank you.
Yep, thanks, Captain. Oh, go ahead, Sheriff.
Point of clarity, so call volume for our statistics, 2020, just to give you an idea, 28,015. 2023, 34,386. I'm not sure, I will reach out to Jason Torrey and ask, I don't know where, without seeing it, I don't know what we're interpreting here, but this is fairly evident that our call volume has not gone down.
Thank you. Captain Barsha, welcome.
Morning.
Remember to please introduce yourself for those listening.
Okay. Good morning. I'm Chris Barsha. I'm the captain at the jail with the Sheriff Department, and I want to invite Tony Stanfield up here with me. Tony is a community partner that I have worked with ever since being at the jail for the last 5 years. Her organization, BDI, also provides volunteer services in the jail in the way of discharge planning, life skills instruction, and individual resources for incarcerated individuals. And she also has an extensive background in behavioral health. So I felt like she could be a resource for me today and you getting your questions answered. In your packets, you got a job description and also a couple support letters from community partners, one about diversion, one about discharge planning. I apologize for not having my PowerPoint for you to read in advance, but I will keep it brief. Little did you know, I yielded a lot of my time to Judge Cooney, and he really set me up good explaining the importance of this position. So moving forward. What is the problem? We have over 40% of the individuals in jail are suffering from mental illness or SUD, and it's probably a little higher than that. So in essence, we're running a hospital. And I have corrections officers who are not physicians, counselors, social workers. So this type of environment is creating a very difficult time for the officers to do their job. We do have the support services and a social worker. We have community partners who come in and provide resources. we have medical services, but they're taxed as well. So a lot of the overlap falls on the officers to have to pick up the pieces, and a lot of times they're just not equipped to handle that. Roughly half of the people in the jail are high medical needs, and they require this extra care, and it often falls on the shoulders of the corrections officer. Munson Medical Center, D6, has 16 psychiatric beds. We could probably fill a quarter of that, maybe a third, with people who are incarcerated today. But because there just isn't enough space, they remain in jail. Challenges for staff caring for the high medical needs, like I said, they're just not equipped like other providers would be. And without a discharge planner, there is not a bridge from somebody getting out of jail and connecting with the resources when they get out. So this person would help with that. One thing I want to draw your attention to is basically the roadmap that thus as board members look to as our strategic goals. When we make decisions, we hope to look at these and follow these. And when I looked at them, I found that the bottom one, focus on the needs of the community, was one of your strategic goals that I felt that this fit the best into. And one of the objectives to meet that goal was to meet the broad physical and mental health needs of the community. I feel by your supporting this position would help you achieve that goal or reach it and the objective that is associated with it. So collaboration with the health department, the HR department, and a lot of research that I've done on my own and collaboration with community partners came up with a job description that HR and EN reviewed and approved. They determined that the appropriate compensation grade would be non-contract, and that's the hourly wage that you see right there. And roughly that's anywhere from $60,000 to $65,000 annually salary, not to include benefits. And this individual would be a full-time GTSO employee. What would they do? So this person would conduct comprehensive screenings and assessments of individuals who come into jail, and they would determine their needs. Do they have mental illness? Okay, what do they need in jail, or what do they need after they get out? Do they have home? Do they need to be connected with resources for a home when they get out of jail? Do they have substance use disorder? Do they need to be connected with a treatment facility? What other needs do they have? Right now, there's nobody in our facility other than community partners who are kind of doing a piecemeal effort to connect people with resources when they get out. Like the sheriff had mentioned, a little history that I would speak about. When I took over the jail in 2019, at that point we had a contract with CMH to have a peer support specialist and a discharge planner, and that contract ended at the end of 2019 and did not get renewed. So at that point, I reached out to Keys to Freedom, one of our community partners, and asked if they could fill that role. Well, they're jail ministry, and they do a bunch of other stuff. And it's hard for them to focus on their work in the jail and the discharge planning end of it. And then BDI does a little bit of it. Catholic Human Services, who does our SUD counseling and treatment in the jail, they do little bits of discharge planning. And in our social worker, what I find is that when they're doing that, they're not meeting the needs of the inmates who are actually in jail, because the substance use disorder is very high, and according to Catholic Human Services, they just aren't meeting the needs in their opinion. So if they're spending time on discharge planning, they're maybe not meeting somebody on an individual basis, on a one-on-one, or doing a group type therapy. And same thing with the other organizations. We need to find an individual who can focus on this, be very effective and efficient, and be ultimately responsible, and then they can make the referrals to these organizations who work in the jail, and then they can continue to do the work that they're in there to do. Diversion planning, Judge Cooney, he explained the importance of it. We don't want people in jail if we can avoid that. A lot of times they can get the care that they need when they get out. And I'm not saying that everybody needs to get out of jail. There's people who need to be there. Don't get me wrong with that. But there are certain individuals who could benefit from the diversion efforts that the court does. And community mental health over the last year or so was doing diversion for those with mental illness. And due to some funding issues, like the sheriff mentioned, that program has ceased to exist. So we have nobody doing that right now. And I think it's valuable. I don't have data to share with you today, and of course, if you want that, I can provide in the future. But the diversion planning is huge. Somebody who can work with the court system, let them know when somebody qualifies for their diversion efforts. And if you think about it, somebody comes to jail, like Judge Cooney says, they get arrested, they go in front of the magistrate to get arraigned, they come and see him. Those are just quick little contacts with a defendant or an arrestee, a defendant at the court system. And they truly don't know what people's needs are. Really, we're the first point of contact to determine that at the jail, and the court may not know it for months down the road. And unless we tell them, hey, we have somebody who's got severe mental illness, and what can we do for this person? How do we get them fast-tracked through the system? What are the alternatives to incarceration? So I think this person would help support the court's effort. They almost go hand in hand. He talked about how sometimes we just put job duties on other people because we want to save money, but then those people fail to do the job that they're supposed to do. So we could say, let's throw it on a corrections officer. Well, I don't have enough just to do the day-to-day tasks. So it really needs to be somebody separate who can collaborate with all the community partners and be very effective and efficient in what they do. Key responsibilities, continued discharge planning, needs assessments. Like Ed mentioned, they're going to determine their needs and then connect them with resources actually before they get out of jail. So that discharge person would make contact with a substance use treatment center and assist with making an appointment. Well, I've learned that when that happens, people will walk out the door and they don't know what to do. So if you could coordinate what that's going to look like, and I've told like BDI Tom Busamra, I said, if you could really help on the outside stuff, let me work on the inside stuff. I feel that's the part that we're missing. So what would happen is discharge planning, discharge coordinator would work with her organization to organize transportation. Well, if that person needs a house, keys to freedom or housing, could work with that organization to secure that and actually have a plan that somebody's going to execute when they get out of jail. And I do know, I talked with our chaplain, she said, I've done all that I can for this person, and there's just nothing more that I can do. Judge Cooney said that people got to want to take the help. Or, you could lead a horse to water, but they got to want to drink in the end. And we find that to be the case. But that doesn't stop us from doing what we need to do to help people. Collaboration, it's just working with our community partners. You've learned that we've got a great group of community partners already established, and this would just be another piece of that puzzle who can basically be a liaison for the jail at the QRT meetings, at the Munson meetings, at the meetings that Judge Cooney just told you about, how they sit down as a group to determine somebody being diverted. They're going to be at that table. Right now, that person's absent. Data collection, that's very important when you're starting a program like this because you want to measure its success, or if it's not going as you would want it to go, you can take that information, reevaluate, and improve something. So this person would be responsible for collecting data over the course of their time, and then that data would be evaluated regularly to decide if we're heading down the right road or we need to go a different direction. Right now with our partners, I know that they keep their own data information, but it isn't something that's easily for me to analyze and tell you that we're being as successful as we can be. Training and education, this person will be networked more than anybody, and they're going to be the ones to be able to tell us, hey, you can improve on your end in these various areas, and they could recommend training for our staff in our division. So that's one component of the job description that's important because I want them to tell us how we can get better. What does the ideal candidate look like? Somebody with a strong background in mental illness and substance use disorder, somebody who has already worked with a court system and understands the inner workings and how the system works. They got to have great organizational skills, case management skills, be very detailed and thorough, and they also have to have great communication skills because you're going to be talking to a lot of people, and that's a key characteristic of the person. And interpersonal relationship skills. They got to be able to work with people. Without that, there's no point in having them. The job description reflects the critical needs of a qualified professional who can advocate for the support individuals with severe mental illness and HUSD in navigating the complexities of the criminal justice system, potentially diverting them from incarceration and ensuring they receive appropriate and coordinated care upon release. That's the job description in a nutshell. That's what we're hoping to achieve. So Tony and I were talking the other day about a place in Italy where they had an island. And, you know, Mackinac, well, if you wanted to build a bridge to Mackinac Island from Mackinac City, how many bridges would it take? Probably just one, right? That most people would say that's all you need is one in, one out. She was talking about in Venice, they have 121, you go ahead and tell the story. I think it's just a good analogy as to why you can't just settle for the minimum. There's a reason why you do more to become efficient in what you do.
So as a therapist, my name is Tony Stainfield. I'm the co-founder before, during, and after incarceration. I am a professional, but I'm also someone with a lived experience, the mother of someone who died by suicide and spent many days in jail. So with that, and also was born in Italy, so please bear with me. Let's go to Venice. Venice, 121 islands. Do you know how many bridges Venice has? 435 bridges. So when we're talking, I'm talking like even the positions that were requested before, I call those the bridge positions. Now, because without the bridge, then you cannot connect services. We cannot trust individual with a brain dysfunction, with inability to plan, to execute, to show up to the doctor's office or the housing to do their work because they're ill. They do not have the capacity. So they need someone to transport them, to walk with them. Navigators, we call them navigators, coaches, connectors, or let's call them bridge, to use and utilize resources that may or may not be available. Because as you know, Commissioner Andrews says, sometimes the resources are not there. So we're talking like Jan Holm talks about potholes. That is that we need services, but they're not there. However, we also need bridges for connecting individuals with resources that are there. Because right now, that's possible that, I mean, we have been collaborating for the last 8 years together, and we have great collaboration. And I'm here about you guys like a strategic plan. We have been working for the last 8 years on working together, and Commissioner Morris has been part of that walk with us in working together to build, not just repair potholes, but we need bridges, we need connectors, we need people who are able to work with these individuals. I went to a workshop, and as we entered the workshop, they gave us little envelopes with they were like, they said they were medication, but they were really M&Ms. And I said, well, take this. At the end of the workshop, they said, who took their medication? None of us took our medication. So sometimes it's not non-compliance. It is that it is part of life. Even people with good brain functions miss their medication. So it is really important. Case management services, supportive services, bridge services, our service, our treatment. Their treatment, they're not just, you know, a useless position. They're very important positions. So that is all that I want to say to you guys. You are in law enforcement is doing the work of mental health workers. I can explain, if you want to, how we got here, because I have the history. But the thing is that right now, law enforcement correction, they're doing the work of mental health workers, and they do not have the training. That's why CIT training is so important. And I think that both the sheriff and the captain are doing, and also the chief of police, they're doing great work in training their staff in meeting this requirement. And And we need embedded social workers. We don't need just probation officers. We need treatment providers. We need social workers. I think there was a time, the way I understand, that social workers were part of the law enforcement. We need to bring them back. Thank you.
Questions?
Commissioner Walter?
Yeah, forgive me, I know you said that Sheriff Shea mentioned something about CMH and the funding going away regarding that position. Can you repeat that?
Yeah.
And give us a little history and kind of, and maybe, I don't know if Penny can speak to that too. I'm right here by my microphone. And
So, it was like 2018, 2019, we paid roughly $200,000 for a mental health professional and a peer support discharge planner position, 2 different positions. And that contract was not renewed. I believe it was 2020 or 2021. And the program that they were running, they weren't in support of changing the program to improve safety in our jail for the individuals who were providing the care. So that contract was not renewed. We couldn't come to terms on the agreement, and it kind of ended right there.
so we haven't had a regular person from CMH there since that contract?
No, that was right about the time I was coming in when all of that ended.
Commissioner Morris, use your mic, please.
That was right about the time I was coming in when all of that was ending.
So can I ask a 2 different positions? We had 2 people that were there up until recently that were doing jail diversion that was through community mental health, funded by a grant through community mental health. That grant has dried up. They are no longer providing that service to the level that they were, 2 people. Rewind to what the captain's referring to. That was a service that we were paying for. We were getting 2 individuals, both of them through community mental health.
Yep, contract.
And under that regime, an agreement could not be reached to continue to facilitate that particular portion of it, which was the discharge planner. Yeah, without getting into the weeds, does that explain what you're asking?
That
It
helps,
was 2
yeah.
separate.
Right, so I was conflating the 2 situations, so thank you for that. But can you provide a little insight into the more recent issue with the grant funding from CMH not continuing? Anybody?
Commissioner, would you like? I mean, I can tell you, I think I know the same thing the commissioner does. And basically, what it amounted to was the 2 individuals that were doing the jail diversion program, because of billing reasons and the funding restrictions, it went away.
That's
That
about
affair,
my understanding, yep.
not on our end, on their end.
I just trying to understand in this very convoluted world, why we pay all this money into CMH. We're not getting those positions. Everybody's nodding, okay, at the jail. And so we're going to pay in addition to that to bring in people. I mean, I'm not questioning the services. We need these services, right? I mean, I think, I don't know, feels like the consensus is that these are very necessary, both from law enforcement, from mental health, creating the bridges with the other organizations that are doing the work. Why CMH isn't offering that seems crazy to me, but.
If I may
It's a
add
really good issue
context.
and what they can and cannot.
So many years ago, we had 2 full-time CMH employees within our jail, Ann Boss and Art Newhouse. They were CMH employees providing social work and other needed services within our jail. For whatever reason, over the years, CMH has restructured and removed those services from our jail. We spend $682,200 a year for our CMH agreement. That is part of that discussion. Now, CMH will tell you that jail services are not directly required per the agreement, we have a different position on that. It is specifically in the agreement that they will provide jail services. So while they are trying to figure out their house over at Northern Lakes, this is something that we cannot let go from our site. They have provided it historically. They provided 80 hours a week, and now we get nothing.
So when I took over trying to understand the enabling agreement and all this, in the original contract we had, I felt like it says services, and they led me to believe that that included services in the community, not in your jail. So, you know, I felt like, you know, the enabling agreement would cover discharge planning. Well, to them, it didn't. So, and I think as far as them coming in and providing like the diversion services, I think it all boils down to Medicaid funds, and can you do services that are in or jail or not? And I think that's what the issue is here and why they're not here. It's kind of confusing. I can't control them. I can only control what I can do in my jail and ask for your support. So.
Captain, how do you currently handle diversions or discharges?
So if we have somebody who has severe mental illness, I'll have, like just the other day, there's somebody in jail right now who could use greater services. And the sergeant said, what can we do with this person? You know, because we continue to have use of force issues, outbursts, potential safety concerns with staff and the individual. And they're going through the court system. So we cannot get them out of jail. They're waiting for competency exams and the court system process that's keeping them there. And it's really between myself, my lieutenant, the sergeants, and staff to figure out where people are at and how can we get them help. Like I even reached out to the prosecutor myself and said, here's the situation. Can you confirm that all of the steps in the court system have been followed and no balls were dropped? Because when that happens, then people just sit longer. So it's a culmination of an effort. We don't have a point person who this person would be that person.
How hard do you anticipate a position like this to be filled? And the only reason I ask that, we know just over the last few years we've had a hard time filling correction officer positions, and I know that's totally different and everything, but do you anticipate being able to fill something like this in the near future if it's approved?
I think it would be very simple. You know, I've talked with individuals who would be interested in working for the county in this spot, and it's not a corrections job, which we have a hard time filling, so it's civilian. It just makes it a little easier that way. And, you know, and I feel like the wage scale that you guys have put into place and the benefits that you've improved over the course of time really makes our county a desirable place to work and be employed at. So I feel like we have an advantage, and I feel like I'd be able to fill it pretty quick.
And when we add in the benefits with this wages, it'd probably bring it up in that 90,000 range?
I was thinking around 80.
Okay.
Yeah.
Okay.
Commissioner, if I could just to add to that, we have had people approach us and say they would love to do this position, and they're more than qualified. And so other than the time frame of going through the hoops, if you grant this position, 24 hours we could have it filled, but we have to go through the hoops. So it will take longer than that, but there is interest in it. There is no doubt in my mind it can be filled.
So is there still current dollars in the 2024 budget if you could fill this immediately?
Yes. Well, you know, I would say yes, but I want to confer with Dean.
Are those dollars from unfilled positions?
Yeah.
And so
yeah,
could we,
if you wanted to use it from 702 and
could we
adjust it.
eliminate an FTE in order to create this?
So it's kind of a slippery slope. You know, HR and talking with them, they say you do not have enough FTEs and officers to cover the workload that we have, the unplanned things that come up, vacations, sick time. We don't have enough. We're always on average about 30. We have 34 FTEs. So if we were to take an FTE away, and then I hired up to 33, and we would probably say, damn, we wish we had that 34th, because then all these people don't have to work overtime.
Would you rather have a jail diversion person and 33 FTEs?
So-
Or would you rather have, I mean, if we've got always 30, the option to add more, what's that worth when, if it gets in the way of getting a really important position, right?
I'm not a gambler by nature, and if I could predict that the diversion planner coordinator would reduce the workload, that you didn't need 34 and 33 would work, then I would say go do it. I feel like I would, I want to ask for an additional person because I would be being a disservice to my staff by saying that this is more important than you right now.
But we would be doing a disservice to the taxpayers if we didn't ask if there's been 4 empty positions on average for the last however many years?
It's been, since I've been here for 5 years, I think we've been at the end of the tunnel, 34 people for just a short time, and then it went away. And then you lose a couple people, then you're back to, interviewing and hiring again and training. Right now, we've made a great push to hire, I think we'll probably be around 31, if all the people who have been interviewed and go through background. So we'll be 3 short, if it all works out. And we're continuing to interview and hire and train.
If none of these positions work out that you're interviewing for, how many vacancies do you have right now?
So we have a total of, we're at 25, and we can have up to 34.
Okay, so you're 9 short. I guess maybe this is kind of along what Commissioner Andrews is saying, but I mean, I think there's a need for a diversion discharge planner. I'd be inclined to see you take one of them FTEs right now and make it this spot. Then if you get to that barrier or that 33, 34 for threshold, come back and ask for another FTE. I think that would be very responsible, and I think that would help fill a void now instead of waiting until the 2025 budget.
So if I may, I certainly understand where you're coming from, all of you. There are collective bargaining agreements in place that we would have to address, and obviously what my preference would be is that we don't remove one of our corrections officers' positions, but in light of where we currently are from a staffing position, if Dean were in favor of this, we will have surplus funding this year on personnel end, that we could move forward with that. And in the event that we are able to fill all 34, I would ask this board to strongly consider allowing us to continue having our discharge planner / jail diversion person. I really don't want and feel strongly about doing away with one of our corrections officers' positions, even though historically we've had difficulty, as nationally people have had difficulty filling them, because based on our jail beds and when we are at population, we need the bodies. And when we lose it, it's not an easy, can we have it back? So you understand my hesitancy on saying, yeah, it all makes sense and I agree with everything you're saying. But I am not willing at this point to give up one of our full-time corrections officers' positions, because if we go back to full capacity, we need the bodies. Go ahead.
But we need a diversion person you said in 24 hours we could fill this position today. Well, in 24 hours, right?
Well, by the time they go through the screening, though, it'd take a little bit longer.
Right.
Yeah.
I get it. But I just I'm concerned, to Commissioner Jewett's point, that having the ability to hire more people in 2025 is at the risk of not filling this position tomorrow. Just seems like this is like government, the worst of government, when we can't reclassify an existing empty position to one that is desperately needed in our community. Frankly, it doesn't sound like it's enough. You had 80 hours a week of services from CMH social worker not that long ago, and we're going to replace it with 40 hours a week. They don't add up, right? So, but meanwhile, we've got empty pieces of, lines on a spreadsheet somewhere. It just doesn't make sense to me, but I'm also, I think we are generally reluctant to just create a new position when knowing that that's going to get us, and I'll say the word, legacy costs, right? Like, it just seems to me, to Commissioner Jewett's point, that that's a pretty elegant way forward to solve a problem that is immediately in front of us without hindering the services that are being provided there now.
I understand what you're saying, and my request would be that we utilize surplus funding from vacancies without changing the staffing plan, and we move forward with it. And then when we are fully staffed, we address the issue of adding the discharge planner and the jail diversion person to our staffing plan as an additional FTE.
Yeah, non-contract.
Non-contract. For the same reason, and please understand my hesitancy, for the same reasons you are expressing why you don't want to add another person is the same concern I have down the road coming to you to request an additional CO. If we were to remove one of those CO positions and go to 33.
Can I ask, is there a reason why you've held off until the 2025 request, knowing that there are surplus funds right now from not having positions filled, and this has been a need for a period of time, based on what you guys have presented for us?
Twofold. The discharge planner went away a while ago.
Right.
But the jail diversion was just kind of dropped on us very recently.
Oh, okay. Okay. Any other questions?
I just like, if I don't know if it's a question for Dean or if it's a question for the sheriff, I'd like to get a sense of how long, what the staffing, the actual staffing has been and the corrections for the last, since 2020 through 2024, so that we can have a sense of how long these FTEs have been unfilled, just to have some context.
We can definitely provide that information, but as Captain Barshev said, I don't recall, and I've been here quite a while, where we've actually been at full staffing in the jail. Quite a while, 30-plus years.
Did you
And
ask-
currently, another piece I think that's critical to all of this, and I don't mean to be disrespectful, we're boarding out a good number of inmates to help with their staffing situation, and we built that cost into the annual budget. So I think that's something that needs to be considered when you look at what that staffing level should be.
Did you ask for 2020 to 24?
I was just trying to get some context. If it's
We-
easy to go back
we
even
can-
further, that would be helpful.
We can definitely take a look at that and provide that information.
I think without the actual numbers, I think it'd be safe to say, since 2020, I don't think, but maybe one time, we've been maxed out with FTEs there in the last 4 years.
Short
I
period
think
of
it was,
time.
I remember twice in my time there.
Okay.
We were right at 34, and then once you get there, then
Yep.
one or two people leave.
Right, that's what I'm saying. So I think we've had them positions unfilled, so there are dollars left over to possibly go towards a planner.
Correct.
I would encourage the sheriff, undersheriff, and the captain to go to our 2023 enabling agreement under the attachment number 3 that quotes the Michigan Mental Health Code that says, quote, each community mental health service program shall provide services designated to divert persons with serious mental illnesses, etc. It is in the health code. This has been a bone of contention with us and CMH, and we probably should resurrect that conversation because I don't disagree. This is very important. These are very important services and they need to be taken care of, but they should have been taken care of by the people that should be providing the service. Those are our mental health professionals. We've picked it up, Commander. We have, and I understand why. Nobly so, in my opinion. But regardless, it truly does fall at Northern Lakes.
That was my follow-up question about it, is have we gotten some legal guidance on that? regarding the discrepancy with how we interpret it and CMH interprets it. These can be parallel paths, right? I don't want to, we need to provide those services, okay? I think we all agree on that. But the fact that we're already paying to provide those services and we're not getting the services is a whole other issue.
CMH will rely on the fact, I think Captain Barchef made mention earlier, they only provide services that are Medicaid funded or Medicaid reimbursed. Well, that's not exactly true. They have general fund dollars that they can use to help offset the cost of these services. It's just, they're an individual board. They have a whole different system that we don't necessarily have direct oversight over. But it was important enough through discussions about reconstructing CMH enabling agreement to put it back in there and actually have it drawn out in an exhibit to the agreement. We didn't want to let it go. And, I understand CMH is in a period of reconstruction, but we should not lose focus on the fact that this is it's in their daily work.
So
If
Tony
you-
would like to speak.
I would like to speak to this because I've been working as an advocate on this issue for the last 8 years. So I do have some history. So remember the analogy of the islands and the bridges? Okay, CMH is an island which is under hurricane, advice right now. There's a lot of stuff going on there that does not allow them to provide services as they should. And starting with the board, starting with, leadership, reconstruction, you'd say reconstruction. I'm not sure they're reconstructing on flood, on swampland. So I don't know if that's whatever they're constructing is going to be efficient. And I'm sure that Commissioner Morris will agree with me. So we cannot wait for them to get whatever, they act together. Many years ago, probably 4 years ago, this commissioners board, this unit, was proposed a decision to split the Northern Lakes and give them only 2 counties to take care of because they're really not capable of taking care of 6 counties. That's too much of a big job. And you, as a board, decided to keep them together. So I also think that that's your responsibility if that island is under a hurricane right now, because that's not going to be fixed. That's at least my professional opinion, that it is very, very difficult. So those are my comments. I'm sorry.
I understand, but I do believe that if it's in the enabling agreement and we are paying for it, we need to do our part to acquire those services that are mandated, and we are paying for them anyway. So I guess we'll look into that further. Anything else, Captain, that you want to add?
No, I appreciate you taking time to hear my presentation and comments. I think you truly believe this is important, but how we're going to make it work, I think, needs to be figured out.
Yep.
I'll work with Mr. Bott in giving you the information that Commissioner Andrews asked for, and I'll be available for any other questions that you have as we move forward.
Sheriff, you have anything?
Just wanted to add, Commissioner, I appreciate what you just said. And can I ask that we get legal counsel's opinion if whether or not, because quite honestly, we're getting differing views, and now we're in the middle of this. And if we could get our legal counsel's stance on whether or not jail diversion and discharge planner is part of that enabling agreement, that would be outstanding.
I would like to go one
Commissioner
step
Andrews.
further. I think getting our legal opinion, as Commissioner Walter also requested, is a starting point, but it sounds to me like we need a meeting with CMH, with the 2 of you and our administrator, and we need a report back before we're going to vote. Here's my proposal. I'm not going to support this until I know where CMH is. This is CMH's area. Severe mental illness, people with Medicaid and severe mental illness is their specialty. That is what they are by state law required to provide services for, including jail diversion. And I feel very strongly that we need an eyeball-to-eyeball discussion among the people who, you're basically proposing that we shift this to the county. If we have to, we will, right? We've got the funds, we've got FTEs available, maybe we need a shift, whatever, but we need this done, and it seems like they should be doing it. And if they're not gonna, we will, but I think, the message needs to be clear to Mr. Martinez that, and maybe Penny is a part of a meeting in the next couple of weeks to make sure that conversation happens.
Our next Northern Lakes meeting is on the 17th. It is here in Traverse City. So I'll work on seeing if I can add that to their agenda.
What time is that meeting again?
It
12?
is at 1:30,
Or
I
1:30.
believe.
At the Hall Street.
Hall Street, Northern Lakes.
Yes.
Well, I do see, I do think there's definitely benefits in seeing this position filled one way or another. Just the diversion alone could save a lot of valuable resources down the road and everything, but I do believe that we want to see who should be paying for it and who should be providing them services, so.
I have a comment too, when you're done.
No, that's all, I'm good. Go ahead, Captain.
So with CMH, they provide services for people with mental illness, not with substance use disorder. So you're going to have people, although we learned that they're co-occurring usually, you're going to have people that have each of their own. CMH is going to tell you, I'm not going to provide services for the people with SUD because they're not mental health. I see that being a conflict, that if we rely solely on CMH. So just throwing that out there. Whereas if it was a county employee, we dictate who they provide care for.
But on the same token, if CMH was to provide some services, then we might be looking at a part-time employee instead of a full-time employee. Possibly. So there's a lot to look into here, so.
Yeah.
Any other questions?
I would like to address.
There are those individuals that would qualify for jail diversion that may not suffer from either.
True.
And at that point, where does CMH come into the equation, right?
But the job description you provided is specifically says for people with severe mental illness. That's
It should have SUD.
reducing the number of individuals with severe mental illness incarcerated in jail. By definition, you've created a position that is directly overlapping with what CMH is supposed to be providing. To the extent they provide additional services, those would be bonus, but it sounds like from the job description, it's completely overlapping.
What would
And if
you
there
say
is
the
a-
percentage of individuals we're talking about here would fall under the mental illness part?
40%.
Okay, so, okay,
And SUD is very close.
okay. Well,
I would like to address the question or problems associated with what the sheriff is kind of scratching at here is if you take away, I'm going to liken it to a different situation. We had FTEs open in the sheriff's department on the law enforcement side of the operation a few years ago. There was a need for an additional detective, and what we agreed to at that point in time is we were going to allow that position transfer to the Detective Bureau, but it was not in and outside of the normal FTE staffing plan. So currently, law enforcement is close to or at their FTE limit. So actually, one of the things that Dean and I have to talk to the sheriff about is you're floating one FTE plus your staffing plan. So if we do, the sheriff's concern is a valid concern, but long-term, I don't see corrections actually solving this problem anytime soon with their staffing, but it is a concern.
One thing I'd like to see come back with the information, Mr. Bott, maybe you can bring this to us in coordination with the sheriff too, is how much are we paying in overtime to fill those gaps? Just as part of that picture, because we can't find people to fill those positions. What does that picture look like? That would be helpful.
You have a range of years, you want it to be 20 to 24?
Sure.
Okay.
anything else?
Does that help? Does that
I-
range work for your needs as well?
I said 20 to 24 originally, but I think 19 would be helpful because
Yeah,
it would give us a
pre-pandemic.
pre-pandemic window. The olden days.
Good old days.
That was so long ago now. Anybody else? Okay. Minister, you have anything you want to add?
No, I don't. We have a separate agreement. I can't find it right at the moment, Captain Barshef, but there is a separate agreement with CMH and the courts specific to diversion, is there not?
Yeah, but I believe that has been expired.
But it's required.
Yeah, I remember Stacy Comiskey got with the courts to get it signed. It was never signed 4 years ago.
But is it not required?
I don't know that.
All right. We'll find that out. Thank you.
Anything else, Captain or Sheriff?
No, thank you.
Okay,
Captain,
thank-
are we going to see you again before you leave us?
Yes.
Okay.
Yes, you will.
This is their
Yeah.
overtime year to date.
Yeah, I'll come to the commission at public comment and just say a few words.
Okay, all right.
Thank you.
I can't read it.
175% budget.
Is there, I got a question
Go
for,
ahead, Commissioner Siebert.
thank you, Chair. Mr. Bott or Mr. Forsyth over there. So when we're looking at, we are boarding jail residents in other counties, is there a way to look at overtime that's being incurred for the empty positions and also the amount of people that are being boarded elsewhere at the same time? That's kind of a big ask, I know.
I didn't catch the first part.
Sorry. So when we're talking about the last 5 years, 2019 to 2024 of overtime for correctional staff due to vacancies that they're trying to cover, I said, is there also a way to, should look at the same time frame of empty bed space or how many inmates are being, or jail residents are being boarded in other counties at the same time?
Well, we can easily quantify the amount or the cost for boarding out inmates for that period. Generally, and just to comment on overtime, when you don't have the optimum staffing level in an operation such as the jail, you're naturally going to backfill that time, and it's primarily going to be overtime. So your overtime costs are generally higher than what we budget, but because of the fact that you don't have full staffing, you're covering that. We've never had a situation where the jail has been over budget in total. But there are times when we have to do a budget amendment to transfer funds from the basic or the your main personnel line item to cover that jail overtime. But they've always still stayed within their total personnel budget. So right now, because of the staffing, the overtime is high. And that's been historically true when they're not at full staffing. But I do know for a fact we've always worked together. The captain lets me know, and we do make those budget amendments, but it's always within the total budget that the board has approved. But yes, we can provide that outsourcing cost as well for that period. As far as the bed count, I don't have that information.
You want it for a 5-year period of time?
For the same time when we're looking for overtime, that's all.
I think it's important to know, too, that the boarding out is to keep our population at about 145. You know, our total capacity is 168. For safety reasons, for classification, and the overtime that occurs during that boarding out isn't necessarily tied to the boarding out. It could be to a hospital security detail, it could be a prisoner transport pickup in Detroit. So it's kind of really hard to nail down, you know, to tie it to the boarding or something else.
Do you have minimum staffing levels required daily?
We have a preferred level. We don't call it a minimum. This is what we want to target it at.
Well-
An adequate, safe level.
Okay.
Thanks, Captain.
Okay, you're welcome. Have a great day.
You too. Moving on to 5B, additional budget discussion. Does anybody have anything else they want to talk about? Additional budget items?
Staff has a couple of points to make. I'd like
Okay.
Mr. Bott to discuss with you the process to date and the level of balance or unbalanced that we are currently at within the general fund.
So we are currently in that phase where we're looking at the requests that were made by the departments and the courts, completing budgets, because the process of entering their line item request doesn't necessarily mean that they're presenting us with a balanced budget. And our focus is primarily on the general fund, looking at those expenditure requests. You know, this morning we talked about the FTE requests. And then we also look at the funds where the general fund transfers funds to, like the courts, parks, facilities, our capital improvement, community corrections, the health department, child care fund, because we want to make sure that we have those amounts factored in to make sure that those funds that you support through a county appropriation are sufficient to cover their operational needs. In summary, the revenues for the general fund are currently at about 50.7 million total, so our general fund is growing, and a lot of that is attributable to the increase in tax revenue. The expenditure requests are about $2 million higher than the revenue that we're estimating or projecting, and that's not uncommon. I mean, that's generally about where things come in initially. So your county administrator is tasked with balancing that.
We're ready to do it.
Yeah, and so we sat down, we've met a couple of times, and we're looking at that process, and we have identified how we would do that. At this time, though, we have not factored in any position requests that might be approved by the board, so that would have to still be taken into consideration. And, on the revenue side, we tend to be very conservative. With your main revenue source, which is the property tax, you're estimating that revenue now without knowing what the state tax commission will do in terms of an inflation adjustment. That usually comes out sometime in November by the state tax commission, which takes into consideration inflation. And also that the other factor that really drives that tax revenue is the increase in the taxable value. And you won't have that number or that information until next April. So we do need to be very careful on how we budget that tax revenue. I'm pretty certain that I'm light in that revenue, but I think that's worked well for us to stay within, an operational model that doesn't cause a problem when we actually get into that fiscal year, which starts on, January 1 of 2025. So I provided both the administrator and deputy county administrator my list of line items that we could look at to balance the budget, and we, we'll be able to do that. You have to by state law. But again, at this point in time, we're kind of working through the requests. The big items are the position requests and how you would fit those in without adding, significant legacy costs to your operation. That once you, add an FTE, you're going to be looking at that cost year after year after year.
Mr. Yoder?
Yes, so did you say $2 million? I didn't
hear. We're approximately $2 million that needs to be reduced from those line item or department requests to have a balanced budget.
That does not include any of the staffing that you just heard today. Additionally, there are still discussions occurring administratively about potential additional staff as needed. One specifically is from the construction code office. We're looking at having some type of administrative assistant or administrative oversight of the Epic GT process, and we don't necessarily have a name for that person just yet, but we know that there's a need to have those services provided, because as we spin this up and push out a public information campaign about how to use that system more effectively, we just know that we're going to need somebody who specializes in that system to take those questions and help them walk through that process. And Mr. Bott and I are still working through the concepts and necessities of potentially additional finance staff. The Workday is a great product, but it's also created processes that we've just never been engaged in. And now we have all of these wonderful attributes with Workday that include reports and wonderful things, but Mr. Bott's office has essentially stayed the same size, and I watch them spin. So we're just talking about it.
With just we're primarily providing information to you this morning on just the general fund, but the position that the administrator just mentioned, that fund has the resources to fully cover. That's not a general fund cost.
That's correct.
And there's 40 other funds that have expenditures, but they really don't have an impact as far as the change. They're self-containing or they have their own funding sources. They're generally a special revenue type fund or a debt service fund where we have those costs built in to the general fund. So your focus is primarily on the significant requests and making sure that your general fund is appropriately accounted for and budgeted for so you can operate when our fiscal year starts next year.
Anything else?
Just Commissioner Walter.
Just to follow up, just looking at the calendar of study sessions and regular meetings, the 9th of October.
That is coming up farther down the agenda.
I know, but this is about budget, so I have a question about, it says in here, we're planning on having a regular meeting on approving the budget on November 20th. But is your understanding that with all of those things that are still out there, that we're going to have another study session on the budget? Or will you bring us something at a regular meeting? What does that look like to your mind so that we're not pushing everything to November 20th?
Yeah, I would defer to the board, but I can tell you that through the preliminary discussions that Dean, Chris, and I have had, we are prepared to make the adjustments to the requested budget. We're ready to downsize that $2 million to bring it into balance, and we could do we have options. We could have that discussion as a study session where we come to you and tell you how we did make those adjustments, and we can have that discussion. But what we were hoping to get from today, and I know that we can't have a vote, but some direction at our next regular board meeting, which positions of these that have been requested, because these are general fund positions, which of them would you like us to cost out and add to the recommended budget? Because that will have an impact on where we reduce in other areas. So I do contemplate that there's going to be at least one more study session, maybe two, specific to budget-related items. But we're ready to move. And unfortunately, we asked the offices and departments back in April to give us their request for employees. So this has been, these employees have been asked for quite a while ago. So it's the new employees that I'm concerned about in terms of the non-general fund and the construction code, but also the general fund potential for finance. But if, so at the next regular meeting, if we could have some guidance from this board to say I either support or don't support those programs. What we didn't get into about the treatment court was the availability of opioid dollars. It depends on how this board chooses to fund that program. If you choose to fund it, those dollars are available to you. I know that there was a statement made in the packet that cannabis dollars could be used. We've really kind of tapped that resource for 2024, and we just don't know the longevity of those funds. So I would caution the use of those funds for that purpose.
Given that less than a third of that position just would be substance use, right, drug court, you couldn't fund that with opioid dollars for the full amount, as I understand Exhibit E to the settlement dollars.
Correct.
You could only, the portion of that was dedicated to SUD.
Correct.
And given the probation oversight and other aspects of the job, it wouldn't be a big dent.
But the treatment court, would that not be exclusively? I mean, I guess there's alcohol associated with that as well.
Treatment court is 2 probation officers to sobriety, that's not SUD, and 1/4 or so of the position is, well, they're very specific that it's about.
I would want to review the guidelines to how you use the opioid funds, but yeah, it's a legitimate concern, legitimate question.
Yep. Anything else?
I would support at our next meeting, because I see one more study session, and then we've got the joint with the city, which we're not going to want to take up budgeting a week before the timeline. That just leaves this next meeting. I mean, the study session on the 23rd looks like it's already got a number of topics on it. So it seems like at least having some preview of what the budget looks like and what the appetite on the positions, what sounds like potentially 6 positions, the 4 we heard about today, plus 2 administrative positions that I think I heard you reference would look like.
I think if we look at the 23rd there, we're talking about security and 520 West Front Street, there's probably time in there if we wanted to add on budget conversation, I think.
Maybe ongoing maintenance, I think, is going to be a long discussion.
I think we only got probably a couple, 2.5 hours right there, so if we wanted, we could add budget on there.
I feel like we do need a regular session because we need to be able to vote on whether we're moving 6 FTEs forward or which of the 6 FTEs, because that's going to have a material impact on the ability to budget
We
to
could
balance the budget.
If we got to that point, we could have a special meeting on the 30th of October. That's the 5th Wednesday of October.
I mean, if we could squeeze it in at a regular meeting, it sounds like our administrator's ready to move.
We are ready to move, and this October 16th meeting, we could place an item on that agenda saying what positions would this board like to see funded
I mean,
and how.
It seems like we've had a study session on it, now we should
Yeah,
vote on
we
it.
could. We could put it on the October 16th agenda. Are there any other departments or elected officials or anybody else that we need to hear from?
Not that requested positions. Those positions were the ones that were requested.
Okay. Was there consensus on placing it on the October 16th agenda?
We're not
Okay.
voting, but I'm nodding my head, yes.
Okay, okay,
Sounds like
Yeah.
6 of us are nodding our heads.
okay. Yeah, well, let's plan on that. Okay, any other additional budget discussion?
Lauren left.
Any other additional budget discussions?
No, sir.
Okay, we're moving on to item 6, second public comment.
If I
No,
may
we
just
have a
address.
study session
The study sessions.
This comes next.
Commissioner
Okay.
Walter, I'm sorry. Are we on this study session discussion or no?
Not yet, we're,
I thought we'd have
number,
public
yeah, I
comment
looked at
after
it
that.
wrong when we added it,
The
but,
agenda says.
Yeah,
number 6 is second public comment, then we get down to number 7, notices for proposed study sessions, so
Right,
we'll do second public comment. That was my error early on, sorry.
that's fine.
Mike Shea, Grand Traverse County Sheriff's Office. Just based on what I just heard, if you're going to make recommendations on the positions that you either support or don't on the 30th,
16th.
16th,
15th of,
16th.
October.
16th, next
16th
week.
of
A week
October,
from
next
today.
Wednesday.
could I ask that you give direction on the discharge planner / diversion position with respect to the enabling agreement and CMH, because that will not be decided by the 15th. And I do not want to lose that position. Hopefully it has traction. So if you could give direction, that's all I ask. Thank you.
Thanks. Any other public comment? Moving on to item 7, updated study session schedule, proposed study sessions.
So the study session that was just mentioned on the 13th of November, which is the joint FMP for the city. We talked about this with the city manager, Ms. Vogel, quite a while ago, but I've not seen any movement on the FMP from the city. So we will reach back out to her and make sure that that is a date that they still have in mind for that joint meeting. And if not, we would have that as a study session as well available to us. I think we should. It's a very important discussion that we need to have, and especially with the way that we are progressing, apparently progressing with our first 3 buildings up on Lafreniere. I'd like to have that discussion with the city commission as well.
The last communication you had with Liz about that, or Ms.
We've had a couple discussions with Ms. Vogel, and it's just the city commission has not had any connectivity to this FMP, to my understanding. Is that a correct assertion? Yeah. So I don't know what that looks like exactly. If the first moment we met to talk about the FMP would be a joint session between the city and the county, I would see there would be challenges with that. So I think that there should be some advanced notice to the city commission so that they can take that FMP, kind of digest it and understand what the difference is between the city and the county operations when it comes to what the city is looking at or the recommendations through the FMP for the city and what the FMP suggestions are for the county. I just have not heard any.
May I make a suggestion? Because it does seem like that's definitely not going to happen before mid-November, given everything else that the cities and everybody's dealing with. But if we could at least have the city manager come with an update on where they are with the FMP process. I doubt that it's going to be on a city commission agenda before then for them to be able to be in a study session situation with us. But if she can give us an update on where the city is in their discussions of the results of, because they went into the FMP process with us. They got results of their own. We just haven't had any joint discussion about that. So maybe she could at least give us an update, even at a regular meeting in the next month or so. Yeah. And then, when we talk with her, maybe we can figure out next steps forward with them on the FMP with a joint discussion. But I don't think it doesn't make sense, given they haven't talked about it, to meet on the 13th.
Yes, Ms. Vogel sees the importance of this and understands the need to have that discussion. They've got their own calendar and they have their own work, and so we will certainly ask her to be here for that.
So related to the FMP, at one point there was a request that I recall, but I don't know if it's reflected in the minutes, that there's a component of the FMP that relates to the jail and the facilities that the sheriff and the city police share, and that having a discussion about that would involve people besides the boards. It would involve, obviously, the sheriff and the city police and the city people, and I don't see that has made either the list of topics or an agenda for a study session. And I don't want to, the facilities master plan is coming up on I don't remember when we got it. It seems like it's been a while that we've had it. Mm-hmm. But having at least the beginning of a conversation about what parts of that proposal have interest or non-interest, and if non-interest, then what else is needed, because we obviously know we're talking about the jail and capacity and all the issues, and it's sort of an elephant in the room from a facilities perspective, in my opinion.
Yeah, that was part of the motion that was passed in April, was that was one of the items that we wanted to have a study session on. And I can look
Okay, we will add that to the list. We do have the 5th Wednesday in October as well.
Yep.
I don't know that the sheriff and the chief would necessarily be in a position to get too deep in that discussion, but I know the sheriff has opinions about where they should be and where they shouldn't be. So definitely we could have that discussion with the sheriff and the chief.
I don't think it needs to be putting anybody ahead of a schedule to, on a fast track, but I do think we should try to get it before the end of the year.
Okay.
You don't?
No, I don't, because people are going to change positions, and we'll have potentially a different board after the election, after the first of the year. And so anything that's going to be made by people on the way out, make a different vote than the people that are getting reelected. If we do it, should do it on the first of the year. Give them time to prepare.
I don't disagree that there may be a different board, but I do think what are the perspectives of the others involved, it is informational that I suspect won't change depending on the makeup of this board, whether there's what we're going to do about it, but we'll also know, right?
You just have a study session.
Yeah, that's my proposal,
we're
is that
talking
it's a
about,
study session just for input.
Well, like our administrator mentioned, we do have October 30th open right now. It could be a study session there, and we could even probably squeeze one in at some other point in time, although we're coming up on Thanksgiving at the end of November, so.
To
Right
that
now.
point, Commissioner Flynn wanted me to mention, because she wasn't able to be here for this piece of it, is having a study session on the opioid process and opioid spending, because that's not calendared, at least here, but you're nodding your head like that's coming.
That is correct. Dr. McGram did send an email to administration. I believe the commission's request of him was to send you a request, but we did receive a request from Dr. McGram to have this discussion, and he had dates that he is available for that discussion. Lisa knows those dates, and we'll try to get him into a regular board meeting, most likely when he's available. I don't think he was available on any of the study session dates. And we are not locked into Wednesdays. We can have a meeting whenever we'd like. As far as the budget goes, we have to have the general appropriations resolution done by December 31st. We're ready to go. It's just a matter of the final preferences of this board and what you would like to put in the final budget.
Well, I'm interested in having that maintenance discussion before we finalize the budget, because a lot of that was about how are we going to pay for ongoing maintenance and underfunded maintenance, and I'm not sure that fits in.
That's on the 23rd, as I understand.
Yep, it is on October 23rd.
Does that feel like that's enough?
It seems to me that partly that is a capital improvement, which is, as I understand it from a budgeting perspective, it's not necessarily tied to our annual budget. Is that fair if we're using fund balance or other sources, or maybe I don't understand that.
No, you're correct, Commissioner Andrews. As it stands right now, the CIP is driven by a calculation after we receive our annual audit that appropriates a certain amount of money over in excess of the 30%. We have had discussions internally with administration and Mr. Chase. We don't think that's the right way to do this any longer. We want to have a true funding mechanism to manage these, and John has done a lion's share of the work in preparation for the discussion on the 23rd. We may very likely have a proposal for you by that time that says, here's a CIP fund, yes, here's something different, and a long-range maintenance plan.
So that would go to your point that we should be part of the budget.
Yeah, because we know that hasn't worked, right? We did the tour to physically see that process is not really working.
Yeah.
Well, like our administrator said, we have till December 31st to approve a budget, so we do have some time in between to have further discussions on different items and everything, so. Okay. Anything else you want to add?
No, sir. Thank you.
Okay. Any commissioner have anything else they want to add? Okay, well, we are adjourned at 12:19 PM. Thanks, everyone.
Hey, I need to borrow your